Hello? Naririnig niyo ako? Can you hear me? Okay. Sige, review muna tayo no sa mga napag-usapan natin last meeting para hindi mawala sa atin yung ating knowledge. Okay, sige. How many times do you read the label? Very good, 3 times. How many patient identifiers do you need? 2 unique patient identifiers. You are using an IM. Ano ang gauge? 21. How many inches? 1 inch. Very good. Magsa-sub-Q ka. What is the gauge? 25 gauge. How many inches? Very good. 0.5 inches. Okay. Ano ang pinaka magandang muscle na gagamitin natin for pedia? It's your vastus lateralis. Okay. And how many times can a nurse attempt IV? 2 times. Okay, very good. Sige, dagdagan natin. How many types of pain meds are there? Ano yung 2 types of pain meds? Sorry. Ano yung 2 types of pain meds pala natin? Very good. It's your opioids and your non-opioids. Okay, opioids and non-opioids. Ilang types ang non-opioids mo? Non-opioids are divided into yes, dalawa. So, non-opioids are divided into ano yun dalawang non-opioids natin? It's your okay, so wala nang sumasagot. It's your NSAIDs and your very good acetaminophen. No, yung mga paracetamol, Tylenol. Okay. Ilang types daw ng ano yung mga 2 types of NSAID? What are the 2 types of NSAIDs? Yung isa, pinipili niya lang ito ang inhibit. Yung isa, walang pili. No? Selective and non-selective. Okay, very good. Selective and non-selective. What is the most common adverse effect of Tylenol? Ang pinaka-common adverse effect of Tylenol. It's hepatotoxic. Very good. Hepatotoxic. Okay. What is the most common adverse effect of naproxen? It's the most common adverse effect of naproxen. To answer this, dapat alam natin kung anong type ng pain med to, no? This is a non-selective NSAID, therefore it is most commonly cause of peptic ulcer. Very good. Yes, peptic ulcer. So, watch out for bleeding. Common talaga ang bleeding sa kanila. Okay, what is the most common adverse effect of enterococcine? The most common adverse effect of enterococcine. Enterococcine, it is a selective beta blocker, therefore it can cause thrombotic events tulad ng MI, stroke, pulmoembolism. What is the most common adverse effect of mepiridine? Mepiridine. Mepiridine, anong type ng pain med to? No? Mepiridine is an opioid. No? So, what is the most common? It's your, anong CCB? Nakasulat dyan, pain meds. Anong CCB? Respy depression. Okay, respy depression. Yan ang pinaka-common na adverse effect. Okay, yung pasyente mo nag-overdose ng paracetamol, Anong antidote mo ngayon? Your acetylcysteine. Okay, acetylcysteine. Okay, very good. Ang patient mo nag-overdose ng morphine. Ano ang ating antidote? Nag-overdose ng morphine. Naloxone or Narcan. Naloxone. Yes. Okay. Sige, let's continue. Okay. Beta blockers. Drug of choice for symptomatic tachycardia. It's your propanolol. Very good. Propanolol. Yes, your propanolol. Beta blockers are contraindicated to, yes, asthma. No? Ano pa? Aside sa asthma, yung may COPD. Asthma and COPD. Okay. Vital signs to monitor. Pag nagbibigay ng beta blocker, ano yung minomonitor natin? Heart rate and BP. Okay. Ano bang ginagawa ng beta blocker sa heart rate and BP? Does it make it go down or go up? It causes it to go down. Vital sign to watch out for when giving beta blockers. What would you watch out for when you give beta blockers? Very good. It's your respiratory rate because beta blockers, non-selective man or selective, can cause the RR to go down. Okay? Kaya niyang pababain. Okay, sige, let's continue. Oh, what is the neurotransmitter affected by your anticholinergic? What is the neurotransmitter? Anong pinapagawa niya? Anong ginagawa niya sa acetylcholine? What does anticholinergics do to acetylcholine? Pinapababa niya si acetylcholine, which in turn, what happens? Pag mababa sa acetylcholine, dopamine increases. And tatandaan, dopamine is a stimulating neurotransmitter. Nakakagising siya. And therefore, you would mostly see what type of autonomic nervous system when you are taking anticholinergic. Kasi stimulating, ano yung nakaka-stimulate na autonomic nervous system? It's your sympathetic. Okay. Sympathetic. What is the most common side effect of atropine? Can't. Okay, kompletuhin nyo. Can't pee, okay. We have a can't pee. Can't see, can't spit, and yes, can't shit. So, ibig sabihin, can't pee, urinary retention. Can't see, blurry of vision. Can't spit, dry mouth. Can't shit, constipation. And also, orthostatic hypotension kasi mababa yung kanilang cardiac output. Very good. What is the most common side effect of neostigmine? It's the most common side effect of neostigmine. Yung isa can't. Kapag cholinergic naman, ano yung ating acronym? SLUD. Okay, what does SLUD mean? SLUD. Salivation, very good. Okay, we have a salivation. Ano yung lacrimation? Okay. Meron din tayong urination. Yes. And yung last natin, diarrhea. Okay, diarrhea. What does it mean to have a positive tensilon test? Ano ibig sabihin yan? Kapag positive yung tensilon test mo, you are positive for myasthenia gravis. Okay, very good. You are positive for myasthenia gravis. Okay, sige, let's continue sa ating recap pa rin. No? Recap pa rin tayo para hindi makalimutan. What is the adverse effect shared by both A's and ARBs? Ano yung adverse effect na makikita mo both sa A's and sa ARBs? Dalawa yon. No, dalawa yon. Okay, hyperkalemia, that's one. And then yung isa, hypercal and angioedema. Very good. Angioedema. Okay, what is the side effect commonly seen in ACE lang? Sa ACE mo lang nakikita yung side effect na to. It's the cough. Very good. Itong cough ba, pwede bang gamutin? Can we cure this cough? No. Okay? No matter what medication you give, you cannot cure this cough kasi side effect siya unless you stop. Very good. Unless you stop taking the ACE inhibitor itself. Okay. What is the electrolyte affected by both ACE and ARBs? It's your potassium. Calcium channel blockers are able to treat AA, and AAA. So, saan natin ginagamit ang calcium channel blocker? First A, it is an anti-hypertensive medication. No? It can lower your blood pressure. Next A, AA, it is a anti-angina. So it can decrease myocardial oxygen demand, no? Para hindi sasakit yung puso. And last A natin, AAA, it is used to treat anti-atrial arrhythmia. Arrhythmia such as, ano yung mga arrhythmia na pwedeng matreat ni calcium channel blocker natin? Your AFib, your A-flat, and we are missing isa na lang, and your SVT, supraventricular tachycardia. Okay, AFib, A-flat, SVT. Vital signs to assess prior giving dilitazem. You have two vital signs you have to monitor pag nagbibigay, before magbibigay ng ano, BP and correct, heart rate. Okay, we hold calcium channel blocker if the BP is, no, if the BP is less than, if the systolic BP is less than 100. Okay, you hold calcium channel blocker if the heart rate is less than 60 beats per minute. Very good. Okay, lab parameter to assess, ay wala pa pala tayo dito. Okay, so ito na ang next topic natin. Okay, we will be talking about mga anti-lipemics. Okay, so any questions? Bumalik na ba yung mga memory? No, bumalik na? I hope so. No, I hope so. Dapat bumalik na yung mga na-discuss natin topic. O sige, we will start with your, tawag yan, for a while lang. Ito ba yun? Okay, sige. Okay, sige. We will start with your anti-lipemic. So, last meeting we ended with calcium channel blockers. So, this time, anti-lipemics naman tayo until we finish, no, our discussion today. Okay, so let's start. Anti-lipemics, indication nito is for increased cholesterol. No? Sobrang taas ng ating mga cholesterol. Okay, we have different medication. Your most famous medications anti-lipemic would be your HMG, CoA, reductase inhibitor, or most commonly known as your statins. Okay, inhibitor. So these medications ends with the word statin. For example, sige, can you give me example of medications that ends with the word statin? Okay, yun. Si atorvastatin. Yan. So ano pa? Rosuvastatin. Okay, so this medication ends with the word statin. Indication for this medication is dyslipidemia. So sobrang taas ng mga bad cholesterol natin. Its main action is to decrease LDL. Okay. So dapat we have to know what is HDL and what is LDL, which is the good fat. Asan dyan si good cholesterol? That would be your HDL. Correct. HDL is your good cholesterol, high density lipoprotein. Dapat greater than 100 milligrams per deciliter dapat to in our system. Okay? We can acquire HDL from healthy sources of fat such as fish oil, legumes, nuts, and certain fruits. Ay, sorry, greater. Oo. Hindi pala greater than 100. Greater than 60 pala. Sorry. Greater than 60 milligrams. Okay. Next, si LDL naman natin. LDL is considered your bad cholesterol. No? Kasi it is mostly related to atherosclerosis or the formation of plaque. Okay? It should exist in our body less than 100 milligrams per deciliter. So, as you can see, even though bad cholesterol siya, nandyan pa rin siya sa ating system because your LDL is needed to create sex hormones such as testosterone, estrogen, androgen, etc. So, kailangan pa rin. Okay? So, what is the adverse effect of your statins? It is hepatotoxic, no? Delikado sa liver. Because its main effect, tatandaan mo to ha, in general to, when the medication acts on the liver talaga ang magkakaroon ng problema. No? For example, statins, its main effect is in the liver. So, liver talaga yung mas stress sa kanya. Okay? Or mga fat-soluble vitamins. Fat-soluble vitamins, di ba, they go to the liver. Doon sila didikit. No? So, si liver ang poproblemahin nila. Okay? So, it is hepatotoxic. Next, it can also cause rhabdomyolysis. No? Adverse effect. Rhabdomyolysis, no, this one is death of muscle tissue. No? Namamatay yung muscle tissue ni patient dito. So what is our nursing intervention then? We have to give it at bedtime. So why do you think best given at bedtime? Any idea? Why is it best given at bedtime? Okay, no activity. Okay, pwede. No? Because when we are awake, most of our body fat is utilized, no? Kung kailangan. So, yes, cholesterol synthesis. It's because when we are asleep, this is when our liver starts to make cholesterol. This is when our liver starts to create HDL and LDL. So we give it at bedtime because this is where cholesterol synthesis occurs. Yan. Another thing is we should monitor the liver values, your ESTs and your ALTs, because this could tell us if the patient is showing signs of hepatotoxicity na. And lastly, check for muscle pain or bone pain, because muscle pain and bone pain could be a sign of muscle tissue death, could be a sign of rhabdomyolysis. Other important things that we need to note when taking statins is ano kaya yung bawal na prutas sa kanya. There is a specific fruit that you will notice na bawal with lots of medications. What is that fruit? It's your grapefruit. No, bawal na naman. Don't take any grapefruit when taking this medication because it increases the risk for hepatotoxicity. No? And the reason for that, it's because grapefruit decreases the elimination of this medication. So, don't take any grapefruit. Next, monitor the patient's urine and urine output. Okay? Because when the muscle tissue dies, there would be a lot of protein that will be created. Diba? That's what your muscle is made of, a lot of protein. So when the muscle tissue dies due to rhabdomyolysis, all that protein will be deposited to your renal system, to your kidney. And eventually, with increased protein in your urine, what do you think happens to the color of urine? Ano mapapansin nyo? Pag madaming protein ang ihi, it becomes yellowish. If there is so much protein in your urine, what color does it turn? Color, it's tea-colored. Tea or cola-colored. Okay, so that's why you monitor the urine. When they start complaining of muscle pain or bone pain, check the urine. The patient might be urinating excess protein. It will start to discolor into cola or tea color. Okay? Additionally, it can even potentiate acute renal damage. It can potentiate acute renal damage. Other antilipemic medications. Now we have your nicotinic acid, solestipol. Oh wait, before I forget, no, another important nursing intervention din pala with statins. Most statins are enteric coated, no? So if they are enteric coated, we should never, kapag enteric coated, you should never crush, no? Break or alter the form. So, do not crush your atorvastatins. Okay, sige. Let's continue with nicotinic acid. Nicotinic acid or solestipol is another antilipemic medication. No, its main effect is that it decreases lipoprotein synthesis. So, ganun pa rin, it is best given at night. Most common adverse effect, is your hepatotoxic. Okay? Next, another anti-lipemic medication would be your fibric acid or fibrates. This medication has the word fib in it, such as your fenofibrate, gemfibrocil, may fib sila. Okay? These medications are used cautiously with statins. You might encounter medications with fibrates plus statins. Those things exist, no? But in general, no, fibrates should always be used cautiously with statins because it can potentiate renal failure, no? Mas tumataas yung risk niya for renal failure as an adverse effect, okay? Because of the rhabdomyolysis. Any questions with your antilipemics? No questions? Okay, let's answer the following. A patient has been taking simvastatin and reports to you that they are experiencing soreness and weakness of the muscle. The physician orders lab work. What lab results below will you immediately report to the physician? Is it number one, increase HDL, two, decrease creatine kinase, three, decrease LDL, or four, increase creatine kinase? So you would report immediately something that is abnormal. So what would be abnormal there? It would be your number 4. Very good. It's your number 4. High HDL is what we want. So this is normal. Low HDL is what we want, no? LDL pala is also what we want. So this is normal. So it's between 2 and 3. The answer is number 3 because creatine kinase, no, reveals muscle damage. Okay? When creatine kinase is increasing, it means a lot of muscle is being torn apart, wherein the creatine inside that muscle is escaping. Okay? So that reveals muscle damage. Yan. So number 4 is your answer. Now, you might encounter a special type of creatine kinase, and that's your CKMB. Now, we called it special because this creatine kinase is only found in your myocardium. That's why your CKMB is one of the reliable signs of MI. No, pag tumataas siya, it could be a reliable sign of MI because the muscle of your myocardium is damaged already. Okay, sige, let's continue. Your patient is prescribed statin medications for the treatment of hyperlipidemia. What medication below may increase the patient's risk for developing rhabdomyolysis if taken with statin? Is it number 1, ezetimibe, 2, gemfibrocil, 3, cholestyramine, or 4, cholesevelam? Answer is number 2, di ba? Fibrates are always used cautiously with statins because it can increase the risk of having an adverse effect, which is your rhabdomyolysis and acute renal damage. Okay? Sige, continue tayo. Now, our next medication would be your anti-anginal medication. No? This type of medication is for, tawag yan, this one is for your acute angina. No? Acute angina. Yan. So for a while lang ha, sandali lang. Because I'm not sure if I'm using the right slides. Hindi ako sure. Okay. Yan. Sige, let's continue. So, next natin is anti-anginal treatment for acute angina. Okay? So, this medication, again, is used to treat acute angina. Mostly for your stable angina. No? Mas maganda siya for your stable angina. Its main effect is that it causes vasodilation and it can decrease BP fairly quickly. So that's why the side effect, the most common side effect is orthostatic hypotension. They start feeling dizzy. That's because blood pressure is decreasing fairly quickly, no, mabilisan. Okay? Aside from that, no, this can also manifest with burning under the tongue and flushing throbbing headache. Both of these are expected. Okay? And it means that the medication is working, especially the burning or stinging sensation under the tongue. It means the medication is working. However, when the patient continues to complain of headache, no, and it's becoming severe while under this medication, it means the blood pressure is dropping very quickly. And that's dangerous. So you have to notify physician if that happens. Okay? So when it comes to nitroglycerin sublinguals, there is a proper storage for this one. Okay? The proper storage would be in a dark, opaque, glass, cool, airtight space. Okay? If you don't follow any of the parameters here that is written there, the medication will deteriorate very quickly. So it has to be a dark, opaque, glass, cool, airtight space. When it comes to nitroglycerin, the maximum would be 3 tablets, no? Because the maximum dose is 3 doses with an interval of 5 minutes. 3 doses with an interval of 5 minutes. Now, it's important because when you're administering nitroglycerin sublingual, no, it has a specific amount of dosage depending on the setting, no? Depends on the setting. Okay? So, in a hospital setting, tatandaan ha, hospital setting, highlight natin yan. In a hospital setting, if your patient complains of chest pain and you know it's angina, give your first dose. After you have given your first dose, notify the healthcare provider if there is no relief. Okay? So in a hospital setting, how many doses can you give? You can only give one dose. Okay? One lang. You cannot give any more. In a home setting, okay, in a home setting or any setting not in a hospital setting, ha? For example, school, company clinic, ganyan. Okay? So, your patient has chest pain, take the first dose. After the first dose, call 911. As you wait for 911 and 5 minutes has passed, give the second dose. Ambulance has not yet arrived, 5 minutes has passed, give the third and last dose. Ambulance is already there, then wheel the patient off. So in a home setting, how many doses can you give? 3 doses. Okay? The home setting will always depend, okay, from the arrival of your ambulance. For example, you have a question, no? Your patient has a chest pain, you give the first dose, then you call 911. After you call 911, ambulance has arrived. Can you give the second and third dose? Yes or no? No. No? No na. The people who will give the second and third dose would be the ambulance crew. Okay, so it will always depend on the ambulance. So you can give a maximum of 1, 2, or 3 depending if the ambulance has arrived. Okay, kapag dumating sa ambulance. Okay, so previously, and I don't know why they changed this, no? If you have a Saunders na 2021 or 2020 na edition, sabi ni Saunders na give first dose, then if there is if there is no relief, give second dose, then call 911. No? If you have the most current, binago niya. Sabi niya, give first dose, then call 911, then give second and third depending on the arrival of the ambulance. O binago niya yung kanyang tawag yan, kung kailan daw magbibigay. Okay? And last, now with this medication, you have to take in anticipation with pain-producing activities. For example, the patient is into Pilates. No? Kung magpipilates siya, take a nitroglycerin sublingual. Yan. Patient is into gardening. No? Mag-gardening siya, inom siya ng isa, then perform the gardening. And lastly, change every 6 months because every 6 months nasisira yung sublingual na nitroglycerin. Okay? Any questions with your nitroglycerin sublingual? No questions? O sige. Next natin is nitroglycerin excuse me, nitroglycerin patch. No, patch na naman tayo. Nitroglycerin patch is usually for long-acting for maintenance. It cannot be used to treat chronic, pang matagalan siya. Okay? So nitroglycerin patch, we give this in a topical area. The site should be hairless, no? Near the chest. Okay? Hairless proximal to the chest. No? And if it is, if it has hair, you have to shave it, but again, you use your electric shaver. And additionally, it also has to be dry. So dry, hairless, no, area proximal to the chest, nearest to the chest. Okay? So don't get confused ha, kasi nitroglycerin patch nearest to the chest. But yung mga opioid patches nyo, as long as the surface is flat, it's okay. No, it's okay. So when you're going to give this medication, no, wear gloves when applying. No, wear gloves when applying to prevent any collateral damage, to prevent from absorbing it. Okay? Next, when you apply, remove the old and gumamit ng bago. No? Use a new patch. Now, sometimes, no, if you are working in an outdated, siguro old school hospital, you might encounter yung mga nitroglycerin patch na tube pa siya, no, parang ganyan, and then you have a dosing paper. No? This is very old school na. Yung mga nitroglycerin patch natin, there is no more dosing paper na. No? It is medicated. Dikit na lang. But when you do, no, it is important that you always, no, determine the amount through a prescription. Okay? Usually, your dosing paper has a measuring guide. So, if the doctor says, no, at least 2 inches, so lagay ka dapat ng 2 inches, no? 2 inches of the nitroglycerin cream on that dosing paper. Okay? And also, no, do not glub it. No, when you say glubbing it, ibig sabihin, for example, ito yung paper, no? When you glub it, parang umiipon siya sa middle. No, that's bad. That's what they call glubbing it. So, apply a straight line lang. So, dapat ganun lang siya. Ayan, no? Depending on the measuring. Okay? So, yan. Pero most currently, nitroglycerin patches, hindi na masyado uso, or there's not much dosing paper nitroglycerin cream in circulation anymore. Okay? Next, when you're giving this medication, rotate the site. No, it's very important to rotate the site to prevent any irritation. No, it can cause irritation kasi pag matagal siya, no, nandoon. Okay. So when rotating, usually this is daily. You rotate daily. No. For the intervals, no, you remove it every 12 hours. No, remove it every 12 hours. Because the longer it is there, the more the patient develops tolerance to nitroglycerin. So it stops working. No? It stops working. Okay? Any questions? Any questions with this nitroglycerin patch? No questions? Okay, sige, let's answer this one. A 58-year-old client diagnosed with coronary artery disease was prescribed with nitroglycerin patch by the physician. The nurse is providing health teaching regarding the medication administration. Select 4 statements that should be included in the teaching. First, apply a desired amount on the dosing paper using a measuring guide. Is this correct? Tama ba to? Answer is yes, di ba? Tama, yes. Okay, that's what I said about earlier, no? Use a measuring guide. Usually, your dosing paper has measurements. Okay. Remove for 6 to 8 hours daily to prevent tolerance. Is this correct? No, no. When do you remove it? Every 12 hours. Okay, every 12 hours. Clean the skin site of application. Of course, this is correct. Rotate the site daily. Yes. Wet the area with alcohol prior to application. No, it has to be a dry area. Apply on the same time every day. Yes, no? So, like any maintenance medication, no, pag sinabing 8 o'clock in the morning, you need to take your, ano ba, losartan, ganun din sa kanila. It's the same applies, no? 8 o'clock in the morning, you have to apply the spatch. So, apply on the same time every day. O, hairy areas can be applied. Tama ba yan? No, no? Kasi dapat you have to shave it using your electric razor, no? Electric razor. Okay, sige, continue tayo. So, no questions so far. Naiintindihan pa naman. Okay pa tayo? Okay, very good. So, no questions so far. Okay, let's continue. Our next topic is your digoxin. Oh, sige, let's put a star on this one. Star on this one. Okay, a big star. So, kung maalala nyo yung mga star natin na medications, I think pang-apat na to. So, digoxin. This medication is a positive inotrope, a negative chromotrope, and a negative dromotrope. Anong ibig sabihin yan? No? When you say positive inotrope, this medication increases heart contraction. Okay? It makes your heart contract stronger, no, the heart muscle. If it is a negative chromotrope, it decreases heart rate. And lastly, if it is a negative dromotrope, it decreases heart conduction. So the electrical system of the heart, no, inaapektuhan ng digoxin, it decreases it. Digoxin is the drug of choice for congestive heart failure. Tatandaan, congestive heart failure. Okay. The side effect of this medication is that it can decrease heart rate and of course headache. Mahihilo konti si patient, no? So it goes without saying, patient might also develop orthostatic hypotension. Just a side effect. The adverse effect is arrhythmia, no? It's severe bradycardia. Now, digoxin has to exist in a narrow therapeutic index, in a narrow therapeutic range. Dagdagan mo lang ng konting digoxin, no? You can kill a patient, no? And I think there's a Netflix show about that one, no? Yung nurse na pumapatay ng pasyente tapos ang ginagamit niya digoxin, no? So ganun kadelikado. You add a little digoxin to a patient, you can actually kill someone. So what is the narrow therapeutic range of digoxin? What is the narrow therapeutic range? So when we say range, dapat from blank to blank. No? From this to this, dapat range. 0.5 to 2.0, okay. 0.5 to 2, so most 0.5 to 2, okay. The way ko siya ma-memorize is 0.8 sa akin. No? 0.8. But 0.5 to 2, no, that's fine. No, that's fine. 0.8 to 2 nanograms per ml. Pero kapag milligrams, that would be 1.2 to 6 milligrams per deciliter. Okay, so remember, if the medication lumampas siya sa kanyang therapeutic range, it can cause tawag yan, a problem. No? It can start causing a problem. NAVDA. NAVDA. N is for nausea and vomiting. Nahihilo at nasusuka. A is for anorexia or the loss of appetite. V. V is for tawag yan, visual disturbance. Okay? The most common, no? Pinaka common na start ng visual disturbance niya is blurry vision. Things are becoming blurry. As it progress, they start to see discoloration, no? They see green to yellow halos around light. Ayan. So when they start reporting this green to yellow halos around light, it means that they are on the lethal level of digoxin na. No? So that's why when they start reporting a sudden change in vision, bigla lang hanap na yung nakikita niya, you might start to worry. But take note, not all visual disturbance are related to digoxin. Pag sinabi niya na, why are there dots in my vision? No? Iba na din yan. Retinal detachment. Yan. Okay? So, basta tatandaan, the start is blurriness. No? Sudden blurriness. And then it will progress to a green-yellow halos around light. Next, D is diarrhea. And lastly, A, abdominal pain. Okay, abdominal pain. So, what is our nursing intervention? Our nursing intervention is to always assess for toxicity. Assess for the presence of NAVDA. Baka nagnanavda na si patient. Next, assess for overdose. It means you have to monitor your trough and peak. Your trough and peak. Hypokalemia. Hypokalemia increases the risk for toxicity. No? The more mababa si potassium, the more mataas ang toxicity niya, ang digoxin toxicity. And ang delikado dyan is that when a patient who has congestive heart failure goes to the emergency department, usually they go to the emergency department because they are retaining so much fluid that they are having difficulty breathing na. There is edema. So in the ER, what doctors usually prescribe is 40 milligrams furosemide IV push. This will remove the excess fluid so they can start breathing. What's dangerous about that is that furosemide lowers potassium. No? So therefore, when you see a patient taking digoxin and is being given furosemide, always monitor signs of toxicity or hypokalemia. So ano ba yung mga symptoms ng hypokalemia? No? Symptoms of hypokalemia are paresthesia. Bigla lang may mga tingling sensation. No? Shortness of breath is one of it too. Okay? Mahirapan na huminga. Next. Okay? And also, furosemide is another drug of choice for digoxin. So, for congestive heart failure. Okay? So, dalawa na yung na-mention ko, digoxin and a diuretic. Yan. Okay? Furo. So, madami kayong natututunan. Hindi lang sa digoxin, pati yung congestive heart failure din. Okay? Ano yung top? Trough, administer, peak. So, monitor your trough and peaks when giving digoxin. Okay? Next, grapefruit na naman. Okay? Grapefruit increases the toxicity pa rin because it prevents the elimination of digoxin in your system. Now, when giving digoxin, meron silang tinatawag na digitalization. No? Digitalization is the loading dose. So, initial dose yan siya. Okay? And when you're going to give this medication, always monitor the apical pulse. Tatandaan mo ha, kapag nasa hospital ka, when you're in a hospital setting and you will administer digoxin, you have to monitor the apical pulse. Okay. Where is the apical pulse located? No, dapat kompleto. Ang first na makakakompleto sa chat, ano, magkakaroon ng ano ba? Magkakaroon ng magandang December o ganun na lang. Sige. Fifth, intercostal space, mid-clavicular line. Ayun, kompleto. Very good. Meron kang magandang December. So, yan. Ay, kulang pa pala. Yun, left. Dapat fifth, left, fifth, intercostal space, mid-clavicular line. Gcash daw. Grabe tong si Romeo ha? Rome? No? Para-paraan. O sige, anong Gcash mo? Joke, walang pera. Okay? So, very good. It has to be in your fifth, left, no? Fifth, intercostal space, mid-clavicular line. Okay, so tatandaan ha, yung complete name, no? Because it is usually asked in NCLEX. Now, you are going to give this medication, okay? You are going to give digoxin. Where will you give it? So, dapat kompleto. Or, kung hindi kompleto, they will show you a picture of someone's chest, no? And then you will have to click asan ang left fifth intercostal space mid-clavicular line. Okay, so you have to find it. Okay? So, pag nagbibigay ng digoxin, monitor the apical pulse. If it is less than 60, do not give because digoxin can decrease it. Okay? It can decrease it. Additionally, no, digoxin can become a maintenance medication for those with heart failure, no? Kung meron na talaga silang heart failure. One of your nursing interventions then is to teach the individual to monitor the radial pulse lang, no? No need for apical pulse, radial pulse lang sila. Ang apical pulse is sa hospital lang to. No? Hospital lang yun siya. Okay? And ang antidote natin would be your digibind. So it reverses the effect of digoxin. So it increases heart rate, it increases the BP, etc. Now there are medications that you cannot give for digoxin. No? And one of the medications which is contraindicated would be your calcium channel blockers. No? If the patient has digoxin, don't give any calcium channel blockers. Additionally, if your patient has congestive heart failure, calcium channel blockers, bawal din. Don't give it. Because calcium channel blockers, no, it decreases heart contraction. So, mas opposite siya sa effect ng digoxin. Okay? Any questions with your digoxin? Any questions? Naiintindihan ba si digoxin natin? Okay, madami akong sinabi. Okay. Sige ha, walang question. Let's answer this one. Mahaba. Okay. Client newly diagnosed with heart failure, prescribed with digoxin. After 1 month, client returned for follow-up checkup. During initial interview, client stated that he has been following a low-sodium, high-fiber diet, including green leafy vegetables such as lettuce and spinach, as well as fruits such as grapefruit and oranges. Client also started incorporating 3 hours of daily exercise but stated experiencing muscle cramps and general fatigue. Client also complained of having tingling numbness of hands and feet, accompanied by shortness of breath and occasional headaches. Client stated that since starting the medication, he started losing weight due to no appetite. Client stated that he also started having episodes of diarrhea. Client complained of having visual disturbances. Stated things far are becoming blurry. Vital signs as follows: temperature 35.7, RR 20, PR 50, BP 120/90. For each of the findings, specify if the finding needs to be follow up or no follow up needed. Okay. First finding, the diet modification. Do we follow it up or no follow up? You have to follow it up. Why are we going to follow it up? Why do we need to follow it up? Anong reason natin? Ayun, no? The client has been eating something, the forbidden fruit, no? The grapefruit. Okay, next. Muscle cramps. Follow up or no follow up? Yung muscle cramps, follow up or no follow up? Okay, so let me ask you a question. If you exercise 3 hours per day, magka-crabs ba yung muscle mo? 3 hours daily. Tatandaan mo ha, started incorporating. So first time ni client mag-exercise. Tapos ang first time ni client mag-exercise, 3 hours a day siya nag-exercise. Is that correct? That is wrong, no? So is the muscle cramp immediate? Do we need to immediately follow it up? Or no? No. Okay? So no follow-up needed because the muscle cramp, it's because of poor exercise. No? What is the minimum time, no, for someone to exercise kapag first time nag-exercise? 30 minutes. So 3 hours a day, no, for someone who started exercising, of course, you will start have muscle cramps. Next, general fatigue. Yan, should you follow that up? General fatigue. Again, no. Because if you exercise 3 hours a day, you will be fatigued. Makapapagod ka talaga. Yan. Tingling and numbness. Should you follow that up? Now, that's something you need to follow up. Because no, even if you exercise a lot, you will not feel any tingling and numbness. Tingling and numbness is usually associated to mga nerves, no, yung nerves natin tinatamaan. Yes, very good. It's because bumababa na yung potassium. O next, shortness of breath. Should you follow that up? Yes, follow it up. No? Headaches. Should you follow up for the headache? Occasional headache. The headache is occasional. So, headache ngayon, not so much next week. No, kasi occasional lang naman, no? If the headache is continuous, no, non-stop, then maybe you follow up. Next, the weight loss. Sorry, weight loss dapat yan. What about the weight loss? Should you follow up the weight loss? Yes. Why did the patient started losing weight? Anorexia, correct, no? No appetite. The diarrhea, do we follow that up? Yes. What about the visual disturbance? Things are becoming blurry. Oh, yes na naman. How about the bradycardia? Should you follow that up? Yes. What is the maintaining beats per minute for a patient taking digoxin? It should be 60 beats per minute and above. Anything lower, bawal. You stop it. Okay, very good. Sige, let's continue. Which is the most appropriate action for the nurse to take before administering digoxin? Number 1, monitor potassium. 2, assess BP. 3, evaluate UO. Or 4, avoid giving with thiazide diuretics. So what is the most important or appropriate action? You have to monitor the potassium. Very good. Okay? Is the blood pressure assessed? Ano ba yung ina-assess natin before we administer? It's your in a hospital, no? In a hospital, apical pulse. Okay, apical pulse. Huwag niyong kalimutan ha, apical pulse. Okay, it's not the blood pressure. Next, which of the following client is the greatest risk for digitalis toxicity or digoxin toxicity? Okay, so to answer this question, find someone who is taking this medication the longest. Sino? Sino yung pinakamatagal ng umiinom ng gamot na yan? Okay, it's your number 4. Bakit? Because congestive heart failure, the drug of choice is digoxin. And digoxin can be used as a maintenance medication. And if you are old, di ba? Na-discuss natin sa first, ano ba? Sa first day natin is, the older we get, the harder to eliminate these drugs. So number 4 ang answer. Okay? Okay, sige, next tayo. Our next would be your anti-arrhythmia medication. So, sorry, most medications, no, na-discuss na natin. Most medications for anti-arrhythmia we have already discussed, such as your beta blockers, calcium channel blockers, and digoxin. So, ang i-discuss ko na lang dito would be your adenocard and amiodarone. No? Adenocard and amiodarone. So, amiodarone. So, treatment for PVCs and VTAC. No? For premature ventricular contractions and VTAC, the drug of choices would be your lidocaine and amiodarone. Okay. However, if you only need to pick one, no, both of them came out, lidocaine plus amiodarone, just pick your amiodarone. No? But if you can pick both, piliin mo silang dalawa. But if only one is being asked, answer amiodarone. So what is amiodarone? Amiodarone. The main effect of amiodarone is that the medication tells your conduction system, mainly in the atria, no? It tells the conduction system in the atria to slow down, no? That's its main effect. It slows down the firing, okay? So it is an anti-dysrhythmic, so it changes the rhythm, no? Usually for PVCs, premature ventricular contraction, ventricular tachycardias, and it can also be used for AFib. Ito yung mga effective, kung asan effective si amiodarone. So, its main effect is that it slows down the heart rate, but it can also affect, no? It can also affect the blood pressure. That is why you monitor the BP and heart rate when giving this medication. What is the adverse effect? Amiodarone is pulmotoxic, no? It is pulmotoxic. So, watch out for the RR if it's falling down. Okay? Next, adenocard. Ano tong adenocard? Now, adenocard, again, is another anti-dysrhythmic medication. No? What it does is, it tells the AV node to slow down. No? Yun ang ginagawa niya. It tells the AV node to slow down. Its main, the way you administer this is through IV push. No? Usually less than 8 seconds, so mabilis. And it has to be flushed by 20 ml NSS. Okay? So IV push less than 8 seconds, flush with 20 ml NSS. When you give adenocard, it's like restarting someone's heart. No? When you give this medication, the heart will suddenly go asystole. So the side effect of this medication is asystole. Okay, so don't panic. The asystole should be for 30 seconds lang or less. Okay? Asystole for 30 seconds. After 30 seconds, the heart rate will come back and it is usually normal na. No? Normal na yung rhythm. Okay? So, what is the adverse effect? The adverse effect is still asystole, but greater than 30 seconds na. Okay? So, it can tell your heart to stop firing altogether. So, delikado siya. No? But the adverse effect, di ba, it's uncommon. So, it doesn't usually happen. Just monitor. It has to be less than 30 seconds. Okay? So, that's for your amiodarone and adenocard. Ano po you watch out sa amyo? Watch out for the RR. No, watch out for the RR because amiodarone is pulmotoxic. It's pulmotoxic. So monitor the respiratory rate. Okay? So yan, very simple anti-arrhythmia discussion lang. Okay, so let's answer the following. A 35-year-old client admitted in the emergency department complaining of chest palpitation and anxiety due to past history of heart complication. At 13:05, the client was seen by the physician and start ECG and chest for stat ECG and chest X-ray. Initial ECG reading as follows. Anong ECG reading ang nakikita niyo? Anong ECG reading yan? Hmm. Ano yan? That's your VTAC. Very good. Kasi ang VTAC, it looks like multiple V's na pinagdugtong-dugtong. No? Parang ganyan. Okay? Ang VFib, wala siyang pattern. Ganyan. Okay? So, anong type of VTAC kaya to siya? Is it pulseless or with pulse? Is it a pulseless VTAC or with pulse? Kasi may VTAC na may pulse, di ba? So ano to siya? Pulseless or no pulse? Ang makakasagot ng tama, nagbabasa ng mabuti. Ayun, with pulse. No? Paano mo nalaman with pulse? Kasi the patient was complaining. Ayun. Okay? So this one has pulse. Okay? So, based on the clinical scenario, which physician orders would the nurse anticipate or not indicated? O, sige. Administer amiodarone IV, anticipate or not indicated? We anticipate. Very good. CPR. It is not indicated. Defibrillation. Not indicated. Administer lidocaine IV. Anticipate. Diba? If you can pick both, pick both. Okay? Pero if you only need to pick one, pick amiodarone. Maintain strict INO monitor. You anticipate because your urine output is a direct reflection of your cardiac output. So good cardiac output, good urine output means good cardiac output pa. Prepare for cardioversion. This one is anticipated. Cardioversion is for VTAC with pulse. No? This is what we do for patients with VTAC na may pulse. Monitor vital signs Q 15 minutes. So, or emergency monitoring na. This one is anticipated because VTAC is an emergency arrhythmia. No? If the patient suddenly has no pulse, then CPR na to. No? BLS na ang kailangan. So that's why we monitor Q15. Okay, any questions so far? Any questions? Okay lang? Okay, sige. Before we continue with medications affecting your hematologic system, let's have a 5-minute break. Okay, 5-minute break muna tayo, then we will continue with medications affecting the hema system. Okay, so see you back after 5. Okay, patuloy tayo. Okay, so ang next natin are drugs affecting your hematologic system. So, lagyan mo yan ng malaking star na din. So, ilan na ba yung mga star natin? Meron na tayong pain, beta blockers, calcium channel blockers, digoxin, and anticoagulants. Okay, coags, or yung mga medication affecting the hematologic system. So, 5 na. Diba? Sabi ko meron tayong top 10 most tested drugs in NCLEX. So, 5 na lang yung ating kailangan pang ma-meet. So, lagyan mo yan ng malaking star ha, yung mga anticoagulants natin. Okay? So, first anticoagulant would be your heparin. Heparin. So, what is the main effect of heparin? Okay? What heparin does is that it prevents thrombus formation. Okay? It blocks the conversion, no? It blocks the conversion of prothrombin, no, into thrombin. So, kung walang thrombin, it reduces the risk of thrombus. Where do we give this? Heparin. Heparin, indications for this one are for patients with deep vein thrombosis, pulmonary embolism, okay, MI, CVA, mga ganyan. So, conditions that have thrombus formations. When you're administering heparin, the route is sub-Q or IV. It is very important to check these following parameters, PTT and APTT. PTT and APTT must be monitored before giving heparin, before the initial dose of heparin, because that would be your control value. Okay? So, best way to remember, di ba? Ang PTT, pag pinag-combine mo, mukha siyang letter H, heparin. Ayun. Okay? So, the control value of PTT and APTT is 20 to 36 without heparin. No? Kapag hindi ka umiinom ng heparin, 20 to 36. Okay? Once you start once you start taking heparin, no? Ang mangyayari dyan is it will be 1.5 to 2.5 times the control value. So it will increase. Magiging siyang 30 to 90 seconds, no? With heparin. So kapag naka-heparin, your PTT and APTT is 30 to 90 seconds. Okay? Heparin is okay for pregnancy, so hindi siya delikado. The antidote for this one is protamine sulfate. However, you cannot give heparin greater than 3 weeks because your body starts to create antibodies against heparin, which increases your risk for drug-induced thrombocytopenia or heparin-induced thrombocytopenia, no, HIT. Okay? So it's very important na hindi siya lumampas ng 3 weeks. Additionally, no, the important parameter, the important thing that we need to monitor for a patient taking heparin is for bleeding. Any signs of bleeding, okay, would be a sign of too much heparin. Too much heparin. But of course, not all signs of bleeding is a sign of heparin toxicity. Okay, not all, but it could be. Okay, so this is heparin. Next, let's meet your warfarin. Okay, so big star and another big star for your warfarin kasi anticoagulants, they like to test this one. So, what does warfarin do in our body? Okay, warfarin, it interferes, no? It interferes with the creation or synthesis of vitamin K. And as we know, vitamin K is needed for creating your clotting factors. Okay. So when you're taking warfarin, vitamin K decreases, no clotting factors, no coagulation. No? So, warfarin can be taken through oral. When you are taking warfarin, monitor the PT and INR. No, PT and INR. But the best parameter would be, ano ang pinaka-best pag nagmo-monitor ng warfarin? Is it PT or INR? It's your INR, your international normalized ratio. Okay? The normal PT is 9 to 12. Nagiging siyang times 2 when you're taking warfarin. The normal INR is, tawag yan is 1 to 2. Again, times 2 din yan siya when taking warfarin. So, 2 to 3 or 2 to 4 is usually your INR when you're taking this medication. Sige. Other nursing interventions for this one is that it has a therapeutic lag of 4 to 5 days. Okay? So it would take roughly around a week before the medication starts working. Okay? Warfarin can be taken for life kasi pwede siyang maging maintenance dose. So once the patient is under warfarin, no, it is important that we check their PT and INR, no, to prevent any signs of bleeding. The antidote for your warfarin is vitamin K because no, increased vitamin K removes the effect of warfarin. Therefore, it's very important to teach the patient to consume a consistent amount, no, of vitamin K rich food. No? So the keyword is consistent, not too much and not too little, because it's still important that the patient has some vitamin K in their system, di ba? So dapat consistent or constant amount lang. Huwag dadagdagan, huwag masyadong marami. Next, we cannot give it to the pregnant because warfarin is teratogenic. And lastly, for heparin and warfarin, monitor for signs of bleeding. You know, that's the most special intervention for that. No? Heparin and warfarin, they have to be placed under bleeding prec. You have to monitor for signs of bleeding. Okay? Any questions kay heparin, kay warfarin? No questions? Naiintindihan? Okay, very good. So if you have any questions, no, ask lang sa chat. No? Ask in the chat. So yan, sige, kompletuhin natin to. When you're giving heparin, what lab value should you monitor? It's your PPT or APPT. Very good. Kapag warfarin naman binibigay mo, what should you monitor? Your PT or INR. Correct. Okay. Kapag si patient nagtitake ng heparin, what will be the control value of your PPT or APPT? Magiging siyang 30 to 90. 20 to 36 kapag walang heparin, but when the patient starts taking the heparin, it becomes doubled. So 30 to 90. Now for the warfarin, what would be the control value of INR when they start taking warfarin? 2 to 3 or 2 to 4, that's okay. Now 2 to 3 or 2 to 4, okay lang. This anticoagulant you can take forever. No? You can take it forever. Which is it? It's your warfarin. So, sa heparin, how long can you take it? No? Less than 3 weeks. Very good. No? This patient has taken so much of this anticoagulant. Your doctor prescribed protamine sulfate. Anong nainom niyang anticoagulant? It's your heparin. Okay? Protamine sulfate ang antidote. What would be the antidote for your warfarin? Vitamin K. True or false? If a patient is taking warfarin, they have to stop eating green leafy vegetables. False, no? Dapat consistent amount, constant amount, no? Not too much, not too little. Okay? So, for both, no, heparin and warfarin, what is our very important nursing intervention? For both heparin and warfarin, no? Yes, no, we have to put them under any bleeding precaution. Yan, kasi both sila pwedeng mag-bleed out. Okay? Very good. Next tayo, ito, low molecular weight heparin, they don't usually ask this one in NCLEX, no? Or hindi siya part sa top 10 most tested question natin. Heparin and warfarin, definitely. But we'll still discuss this. Okay. Enoxaparin, Levonox, or also known as your low molecular weight heparin, its main effect is that it blocks clotting factors XA, no? Its main use is for, again, any conditions that there is no thrombus formation, such as DVT, okay, route, sub-Q. Now, enoxaparin does not impair your PTT or APTT. What it does impair, however, would be your your thrombocytes. That is why when giving this medication, you have to monitor CBC plus platelet. Okay, tatandaan ha, it affects the platelet mostly. No, it affects the platelet mostly. But when taking this medication, you monitor for CBC and platelet. Hindi lang platelet ang answer. Dapat sabay sila, CBC and platelet. Okay? Next, you should not use this with another heparin because it increases the risk for heparin-induced thrombocytopenia. And again, bleeding precaution pa rin. Okay, bleeding prec. Okay? So kung heparin, you monitor the PTT, APTT. The warfarin, you monitor the INR. For low molecular weight heparin, you monitor the CBC and platelet. Sabay. Okay? Now, another medication that can affect your HEMA system would be your blood thinners, your antiplatelets. So, yan. Blood thinners or antiplatelets. This medication, ang pinaka kilalang gamot dito would be your aspirin, ASA. No? Aspirin. Okay, pwede din clopidogrel. No? It's another known medication that inhibits platelet aggregation. Okay? So it decreases platelet aggregation, that's the main effect. No? And how does it do this? Well, it affects the COX. No? It affects your cyclooxygenase. Yung na-discuss natin sa NSENS. Okay? So, treatment nito, it is used for coronary artery diseases, hyperlipidemia, and diabetic mellitus, no, because it thins the blood. In both hyperlipidemia and DM, the blood is usually viscous, malapot, thick. Okay? Common side effect is GI upset because it can inhibit COX-1. No? Pwede niya ma-inhibit. So, give with meals. No? Give with meals. Another adverse effect would be bleeding, especially when they're taking a lot of this medication, no? Because it can induce drug-induced thrombocytopenia. So it can decrease the platelet count. Drug-induced thrombocytopenia. And it can also be ototoxic, especially yung ating aspirin. So what is our nursing intervention? Ayan, monitor for signs of bleeding, given after meals to prevent GI upset, and again, put the patient under bleeding precaution. Bleeding prec pa rin because thin yung dugo. No? The blood is thin. Okay? Any question with your antiplatelets or blood thinners? Okay? So of course, you also don't give with other blood thinning, no? Blood thinning supplement. So supplements that contain garlic, ginkgo biloba, grapeseed, no, nakaka-blood thin din yun. So don't mix it. If you're taking aspirin as part of your maintenance medication, you have to tell the physician if you are going to take another supplement that can induce blood thinning. Okay? Sige? So, ang next natin would be colony stimulating factors or medications that increase naman, no? That increase the amount. Okay. So, first would be your epogen or epoetin. Okay? So, epogen or epoetin is a colony-stimulating factor. Mainly, it stimulates your red blood cell. No? It increases the red blood cell. So, it is indicated for severe anemia and chronic kidney disease because in CKD, no, hematopoiesis or the creation of red blood cell is no longer available, no? Kasi sira na yung kidney. The action is hematopoiesis, which means creation of new RBC. Okay? Side effect is that it can increase the BP and it can induce leukemia. No? So, di ba, with leukemia, one of the colonies in your blood is too much, no? Yung alam natin na leukemia, yung cancer na leukemia, yung pinaka-common na dumadami would be your white blood cells. But in any time na mas dumami yung thrombocyte, WBC, or RBC, considered siya leukemia. So it can induce leukemia because your RBC will be too much, no? And your WBC will start to decrease, and your thrombocyte will start to decrease. So you have to watch out for this one. Okay, increased BP and leukemia. Okay. Other nursing interventions is that epoetin can be used as performance-enhancing drugs by runners or endurance sports. Okay, so we already know that. We have already discussed that, diba? Sa first day natin. Next would be your Neupogen, your filgrastim. So if epogen increases RBC, Neupogen increases WBC, mainly your neutrophils. No? Increases WBC. Ayan. So, indication for this medication is that it is used to treat secondary, neutropenia pala, secondary to chemotherapy. So, because prolonged chemotherapy can cause decrease of white blood cells na magbibigay tayo nito para ma-normalize siya. Nursing intervention natin, it is contraindicated to immunosuppressants. For example, no, your patient has lupus, no, systemic lupus, and umiinom siya ng methotrexate. Methotrexate for lupus, no, this one is used to decrease immune system response. So you cannot take them together, no? Because methotrexate decreases, is an immunosuppressant. Neupogen boosts immunity. Pinapataas niya yung WBC mo. Aside from that, it is also contraindicated when giving vaccines. So, you cannot mix them together. No? Hindi ka pwedeng magbibigay ng vaccine at the same time Neupogen. Okay? Because baka counteract yung effect ng vaccine. You will not develop the immunity needed. Okay? So, meron na tayong RBC, WBC. Our next colony medication, why ulit yung leukemia? So, ang ano kasi, anytime, di ba, ang colony ng ating dugo would be your RBC, WBC, and platelet. Anytime na dumami ang isa dyan, no, leukemia ang tawag natin dyan. No? For example, sobrang daming platelet, wala ng RBC, WBC, leukemia pa rin yan siya. Yan ang definition ng leukemia. No? Yung alam natin na leukemia kasi, yung cancer, WBC ang tumataas. Diba? Yun yung dumadami kaya nawawala si RBC, si platelet. So, epogen can induce leukemia because when you have too much RBC, mag-overcrowd na yan, ang WBC mo bababa, ang platelet mo bababa. When one of the colony is too much, it can induce leukemia. Okay? Akala ko din dati na pag sinabing leukemia, WBC lang. Hindi pala. No? Anytime na may sumobra, no, within doon sa colonies mo sa dugo, RBC, WBC, or platelet man, basta isa lang dyan dumami, leukemia na ang tawag yan agad. Pero ang pinaka-common kasi would be your white blood cells na tawag yan na leukemia. Kaya siya mas tinatawag na leukemia kasi yun yung common. Okay? Sige, let's continue. So, meron na tayong RBC, WBC. Ang next natin is platelet. No, platelet. Also, nga pala, no, Neupogen can also induce leukemia. Lagay mo din dyan, pwede din siya mag-induce ng leukemia. Kasi kapag sobrang dami na si WBC, mawawalaan ka na ng RBC at platelet. Bababa din yan. Okay? So, ang new mega, no, or oprelvicin, this one stimulates platelet. No? Nagpapadami siya ng platelet. Okay? So, yan. So, with this one, no, the most common side effect is fluid retention. So, mild edema, lalong-lalo na mild peripheral edema is expected. Okay? Mild peripheral edema is expected. However, no, kapag sobra na, the patient is now having difficulty of breathing. It means adverse effect na yun, no? You have to watch out for that one. So, very important that you start watching out for any signs of swelling. Watch out for swelling because mabilisan na yan siya. Start yan swelling, no? Peripheral swelling, eventually, fluid overload agad sila. Magiging mahirap ng huminga. So watch out for swelling in the peripheries, no? Or in your legs. Okay, so that's for your new mega. Okay, so Epogen was for your RBC, Neupogen, WBC, New mega is for your platelets. Okay? So with this one, hindi siya masyado related to leukemia. No? Fluid overload siya. Okay? Okay, next tayo. 1, 2, 3. Yan. Okay. Which patient below would be a high risk for developing an adverse effect for heparin? Select all that apply. Okay. So ano nga ulit ang adverse effect ng heparin? Adverse effect ng heparin natin, binabantayan natin sila. Oh, yes, no, heparin-induced thrombocytopenia. Pero another thing, no, common sa heparin na babantayan mo talaga, it's bleeding. And bleeding, ito yung pinaka-common na adverse effect. Yung HIT, hindi siya ganun ka-common kasi it only appears when you take the medication greater than 3 weeks. So bleeding ang pinaka-common adverse effect. Sige, so sino daw dito at risk for bleeding? Okay. Number 1, a 55-year-old male who is post-op day 1 brain surgery. Is this at risk for bleeding? Pag binigyan ng heparin? Yes. Okay, piliin natin yan. Number 2, 45-year-old with pulmoembolism. No. In fact, indication, di ba yan? Pag may embolism, dapat may heparin siya. Number 3, 36-year-old active peptic ulcer. Yes, no, because if you have an active peptic ulcer, it means you are actively bleeding. Okay. 43-year-old with uncontrolled AFib. At risk for bleeding ba yan? No. Again, another indication. Diba? Because if you have atrial fibrillation, what happens to your heart? No? It is just shaking in place. They call it as quivering. Nagquiquiver lang siya. When your heart is quivering, no, mataas ang risk for thrombus formation. So that's why patients who have AFib needs to take heparin to prevent thrombus formation. So answer natin is 1 and 3. Okay. A patient who is receiving continuous heparin has a APTT of 105 seconds. What is your next nursing action per protocol? Number 1, continue with the infusion because no change is needed based on APTT. Number 2, increase the drip rate per protocol because APTT is too low. Number 3, redraw the APTT stat. Or number 4, hold the infusion for 1 hour and decrease the rate per protocol because the APTT is too high. So anong gagawin natin? Answer is yes. Number 4, you have to hold the infusion kasi sobrang taas na. Again, when you're taking heparin, what should be the APTT? Very good. It's 30 to 90 seconds. Okay? Sige, next tayo. So, hindi mo na natin ito a-answeran ha. Kasi nire-repair ko pa tong question na to. Okay, diretso na tayo dito. No? Drugs that affect the respiratory system na tayo. Okay? So first would be your theophylline, no, or aminophylline. Theophylline, aminophylline, these are xanthines. No? Xanthines. Xanthines are mild stimulant. No, these are mild stimulant, but we use this one for our respiratory system because it is one of the effective bronchodilator. It's an effective bronchodilator. And that's why, no, this medication is given for patients with status asthmaticus or asthma that is not treated properly anymore, no, or worsening asthma, and COPD. No, COPD. Nursing intervention natin is that theophylline again has a narrow therapeutic range, meaning it has to be kept at 10 to 20 micrograms per ml. Greater than 20, patient starts to develop toxic effect. Less than 10, nawawala yung effect ng gamot. So, the earliest sign of toxicity, no, would be nausea and vomiting. Late signs would be coarse hand tremors. As this medication, no, as this medication continues to rise in toxicity, ano mangyayari? Everything starts to go up, no? Nagkakaroon na siya ng increased heart rate, increased BP, no? Increased RR, lahat tumataas. Deep tendon reflex increases, and eventually the patient will undergo a seizure. Everything's gonna go up kasi stimulant siya, di ba? So magsi-seizure siya. After the seizure, the patient will be comatose and then mamamatay siya. So therefore, very important, it has to be kept at 10 to 20 micrograms per ml. Okay? So, what is the treatment for poisoning? No, the treatment would be activated charcoal. Same as your phenytoin. Diba? Phenytoin, dapat 10 to 20. And the antidote is activated charcoal din. Okay? Sige, let's continue. Now, ang next natin na medication is another important one, no? Yan, lalagyan na naman natin to ng isang malaking star. Okay, so 6 na yung stars nyo, di ba? Next, corticosteroids, no? Or the medications that ends with the word zone. Zone. No? Tulad ng iyong, sige, give me examples of corticosteroids. Prednisone. Ano pa? Prednisone. Yes, ano pa? Wala na. Basta sir, zone ang last name niya. Madami ba, di ba? Betamethasone. Ano ba yung D na dexamethasone din? O basta, zone ang last name. Okay, zone. Dexamethasone, ayun pala. Okay, so what does corticosteroids do? Anong ginagawa nito? Corticosteroids has the same effect as the hormone in your body, cortisol. And that's why dyan niya nakuha yung name niya. Cortisol, corticosteroids. No? Corticosteroids, it's the same. No? Cortisol and corticosteroids, it's the same. So if you know what cortisol does in your body, you already know what corticosteroid does in your body. If you don't know what cortisol does in your body, no? That's okay. Let me explain. Okay, so ang ginagawa ng cortisol, no, is that, no, it is a stress hormone, no? This one is a stress hormone. Every time you are stressed, cortisol level increases. Okay? So, when your cortisol level increases, no, what it does is that it decreases the effects of your arachidonic acid. Sir, ano yung arachidonic acid? Huwag mo nang intindihin. Basta tatandaan mo, kapag walang arachidonic acid na yan, it decreases inflammatory response. No? Inflammatory response. Yan. So kapag mataas ang cortisol mo, decrease in inflammatory response. And as we know, inflammation is very important when it comes to immune system, di ba? Every time masusugat ka, kailangan mag-inflame siya para yung mga WBCs mo pumunta doon sa lugar. No? Kapag may ubo ka, your lungs are inflamed for the WBC, no, para pumunta doon. Additionally, inflammation can also help us perceive pain. No? Kapag inflamed ang isang area, di ba? That is in pain. So, you will mend it. Pag mataas ang cortisol level mo, wala kang inflammatory response. Okay? So bakit? No? Just think of being stressed, 'di ba? Kung stressed out ka na, no? Your body tells you it's okay, no? I got your back. You will not feel the pain, just continue the work. Ganyan, 'di ba? Kapag stress ka sa trabaho, no? Hindi mo mararamdaman na ang sakit na pala ng paa mo kasi mataas yung cortisol level mo. No? Sinasabihan ka ng katawan mo, sige, patuloy ka lang dyan sa trabaho mo, wala kang pain na mararamdaman, wala kang inflammation na mararamdaman. Yan. Okay. So, decreased inflammatory response also decreases immune system. Sabay yan sila. Yan. That's why pag masyado kang stress, madali kang magkasakit. Additionally, di ba, kapag stress ka, anong ginagawa ng cortisol? It's trying to find energy somewhere. And what is the main energy source sa ating katawan? It's your glucose, sugar. So isa din yan sa effect ng cortisol. It increases sugar in your body. You need sugar to go through that stressful day. Kung wala kang sugar, wala ka ding energy. So cortisol decreases inflammatory response, increases sugar, which also in turn increases hunger. Madami pang ginagawa ang cortisol. Okay? Cortisol also breaks down muscle. No? Breaks down muscle. Bakit? Because muscle, no, is one of the best source of sugar. Sirain nila yung muscle mo, they convert that to sugar. Okay? Yan. So madami pa siyang effect. It can even affect your mentation. 'Di ba? Pag may nakita kang stressful na ka-workmate, ma'am, napansin mo parang sira ulo na, kung ano-ano lang sinasabi, nagdadabog. Ganun din, no? Cortisol, changes your mood kasi. Kaya ka parang stressed out, galit. So lahat ng na-mention ko, yan ang effect ng corticosteroids. It's the same effect, no? When you take corticosteroid, no inflammatory response, no immune system, mataas ang sugar, muscle starts to break down, and you are constantly stressed out. Marami kang mood swings. Okay, so that is why you give this medication for patients with asthma. Kasi kung may asthma ka, you have inflammation in your lungs. For allergic reactions, if you have allergic reaction, again, inflammation. For autoimmune individuals such as RA, no, you want to decrease the immune system response, or for any inflammations in the body. No? So what is the main action? I have already told you the main action, reduce inflammation and swelling. So itong swelling na to, it talks about edema formation. No? Because cortisol can also retain water. It can retain water. Corticosteroids retain water. So what should we watch out? What is the side effects pala? Okay. The side effects of your corticosteroid is weight gain. Increase sugar. Di ba? Pag tumataas ang sugar, minametabolize yan. No? Pag hindi nagamit, gagawing fat. No? So, weight gain. Next, hyperglycemia. Increase sugar. Swelling, which is usually edema formation to, no? May mga edema. Mood swings. Yan, ano pa? Yung muscle mo starts to, waste. No? Medyo payat ka na, namamayat ka na. No? So yan ang side effects niya. The adverse effect naman. The adverse effect is immunosuppression. Your immune system is so low, no? Nagkakaroon ka na ng mga opportunistic infection, and therefore, you have to watch out for any signs of early infection. O sige, what are the signs of early infection? Ano ang sign mo ng early infection? Yes, fever is one of them. Ano pa? Ano pa? Sore throat. Ayun. Fever, sore throat. And sa mga babae, ano? What is the earliest sign of infection sa babae? UTI, no, urinary tract infection. Yan. So, dysuria, painful uh, urination with blood. Ayan. Okay, so these are early signs of infection. So watch out for that kasi adverse effect niyan. Hindi common ang fever sa naka-corticosteroids. Next, bone demineralization. No, when they start complaining of bone pain, adverse effect na yun. You have to report that. Aside from that, diabetic mellitus. You have to report that. Okay? So kanina, we mentioned that hyperglycemia is a side effect. So it is expected that blood sugar is a little on the high. No? Medyo mataas yung blood sugar nila. Pero kapag mataas yung blood sugar nila, tapos meron ka ng polyuria, polydipsia, polyphagia, that is no longer expected. That's an adverse effect kasi DM na yan, no? Diabetic mellitus. No? Aside from that, pwede din siya makakos ng cataracts. Yan, at madami pang iba. No? Madami pang iba. Oh, before ko makalimutan, because of this edema formation or water retention, now, one of the side effects pala is also hypertension. So, wag magpapanik kapag medyo mataas ang blood pressure ng patient na naka-corticosteroids. That's common, no? Common lang yan siya. Okay? So, what is your nursing interventions? Ayan, your nursing interventions is to monitor weight before meals. Now, this will tell you if the patient is retaining a lot of water or kapag nagwi-weight gain na si patient. Next, give after breakfast. So we give this after breakfast because corticosteroids can cause GI upset. One of the common side effects din pala, no? GI upset. Okay? It can cause GI upset. Additionally, the reason why you give it in the morning, it's because you are trying to pattern the actual release of cortisol, the hormone in your body, no? Ang cortisol, yung stress hormone natin, mataas yan siya kapag umaga, no, when we wake up, and kapag ngayon, in the afternoon, no, or during noontime. So therefore, the best time to give corticosteroids would be after breakfast or after lunch, no, kasi pinapattern natin yung actual release ng cortisol. Okay? Next, monitor the glucose level and watch out for signs of diabetic mellitus. Additionally, once the patient is taking corticosteroids, you cannot abruptly stop it. No? Bakit? Bakit hindi mo pwedeng i-stop ang corticosteroid agad? If its side effect is hyperglycemia, no? Common talaga sa naka-corticosteroid, mataas ang blood sugar nila. What happens when you abruptly stop corticosteroid? Anong delikadong pwede mangyari? Hypoglycemia, no? That's why you cannot stop corticosteroid biglaan. No? Kasi common na sa kanila na mataas ang blood sugar. Sanay na yung katawan nila na medyo mataas ang blood sugar. Pag na-stop yung corticosteroid, babagsak bigla ang blood sugar, mas delikado tuloy, no? Hypogly. So watch out for DM and hypogly, especially when abruptly stopping. So do not stop it abruptly. No? Next, watch out for poor wound healing. This is because of decreased inflammatory response. No, that could be another sign of decreasing immune system. Okay? So, no, ano ba ang mga examples natin ng mga famous na corticosteroid? Well, we have your betamethasone. I guess, kilala na natin si betamethasone because this is usually given sa OB natin, di ba? Sa OB, no? Pero meron din tayong methyl, prednisone, no, prednisolone, ayan. Methylprednisolone. Yan. So another famous corticosteroid. Bakit to siya famous? Because this is the drug of choice for, no, mga herniated disc or mga spinal injury. Yan, in general na lang. Spinal injury, especially affecting your lumbar spine. Yung mga lower back injury, no, pag pumunta ka sa ER, tapos nagre-report ka ng lower back injury, no, hindi mo nagagalaw yung paa mo, sakit, yan ang ibibigay nila. Methylprednisolone or solumedrol. No? Yan yung emergency med dyan. Para mawala yung inflammation sa spine mo, no? And bumalik yung sensation sa paa. Okay? So, any questions with your corticosteroids? Any questions with your corticosteroids? Naiintindihan si corticosteroid? Okay, so tatandaan ha, yung mga side effect and adverse effect. Okay, very important na ma-remember yan. Kasi pag sinabi mong side effect, expected mo yan. Hindi ka magpapanik. Pag adverse effect, magpanik ka na kasi delikado na siya. Okay, sige, let's answer this one. A nurse and a nursing student are reviewing the care of a 30 kilogram patient who will receive intravenous aminophylline. Which statement by the student indicates an understanding on the administration of the medication? Number 1, after the loading dose has been given, the patient will receive 6 milligrams per kilogram per hour. Number 2, dosing is titrated based on serum theophylline levels. Number 3, if the patient's serum theophylline is less than 15 micrograms per ml, the rate should be reduced. Or number 4, the patient will receive a loading dose of 180 milligram over 5 minutes. Okay, so ano yung na-discuss natin earlier? Ang answer dyan is number... Meron ba tayong pinag-usapan na loading dose ng theophylline? Wala, di ba? So wala na tong si number 1 at saka si number 4. Oh. Correct answer is number 2. Di ba? It is titrated based on the serum or the blood theophylline levels. No? Kapag masyadong mataas yung theophylline level sa dugo, babawasan. Kapag konti naman, tataasan. Okay? So very good, number 2 ang answer. Okay, ang next natin na topic would be drugs affecting the endocrine system. Okay? Sige, bigyan mo yan ng isang malaking star. Yan, bigyan mo ng isang malaking star. So, pang ilan na yan? Pang 8 na ata yan? Tama ba? Or 7? O 7 pa pala. So, 3 na lang, no, yung kailangan natin ma-discuss na top 10 most important tested drug. Yan, insulin. Paborito nila to sa NCLEX. And when it comes to talking about insulin, the most favorite thing they like to talk about is the onset peak duration. No, onset peak duration. That's why it's very important. No? It's pertinent that you memorize this one. Okay? So, I cannot teach you how to memorize it, no? Because the only way to memorize it is through repetition. Diba? Kung nagme-memorize ka ng cellphone number, uulit-ulitin mo hanggang ma-memorize mo yung cellphone number. Ganito din with onset, peak, and duration. No? Paulit-ulit dapat to siya. So, onset, peak, or duration, this is when you give the insulin, di ba? As discussed earlier, ang peak ng subcutaneous medication, it is not based on the route, it's based on the drug, tulad ng insulin. That's why dapat memorize natin siya. No? Peak is also known as your period of hypoglycemia. Period of hypoglycemia. Okay. So, paano natin ito siya i-memorize? No? Dati, yung kukunti pa lang yung nag-NCLEX na review, ang ginagawa namin is, one by one, no, tinatanong ko yung mga students, i-re-recite nila. Yan. Dahil marami tayo, hindi natin pwedeng gawin kasi sayang sa oras. So, no, ang gagawin natin is i-chat nyo na lang. No? I-chat nyo na lang para makikita ko kung nag-answer pa rin kayo. Okay? Pero wag kayong mangungopya, di ba? Sige, start tayo. Very short. Aspart and Lispro. 15, 30 to 1, 2 to 4. Short. Regular Humulin R. 30 to 60, 2 to 4, 4 to 6. Intermediate. NPH Humulin N. 2 to 4, 6 to 8, 16 to 20. Long. Ultralente. 6 to 8, 12 to 16, 20 to 30. Very long, Glargine and Lantus, 1 hour, no peak, 24. Ganyan pag memorize nito. So napapansin nyo na si very long, si Glargine and Lantus, wala silang period of hypoglycemia. So, okay lang yan. No? Okay lang yan, hindi siya nakakakos ng hypogly. Sige, ulitin natin. Now, in your own seats din, ulit-ulit yung sasabihin. Very short, Aspart and Lispro, 15, 30 to 1 hour, 2 to 4. Short, regular Humulin R, 30 to 60, 2 to 4, 4 to 6. Intermediate, NPH and Humulin N, 2 to 4, 6 to 8, 16 to 20. Long, ultralente, 6 to 8, 12 to 16, 20 to 30. Very long, Glargine and Lantus, 1 hour, no peak, 24. Okay? O sige, answeran natin to. Very short, Aspart and Lispro. Kailan ang onset? (15 minutes). Kailan ang peak ng Aspart and Lispro? (30 to 1 hour). Ang duration? Very good. 2 to 4 hours. Short, regular Humulin R. Kailan ang onset? 30 to 60. Ang peak? 2 to 4. Duration? 4 to 6. Intermediate, NPH Humulin N. 2 to 4. Peak? 6 to 8. Okay. Duration? 16 to 20. Long, ultralente? 6 to 8. Peak? 12 to 16. Next. Duration? 20 to 30. Very long, Glargine and Lantus? 1 hour. Peak? No peak. Duration? 24 hours. Yan, okay? So, praktisan nyo, no? Sa, on your own seats, no? Sa bahay nyo. Paulit-ulit. Onset, peak, duration. Ganyan. Paano kasi ang tanong nito? Ang tanong usually kapag insulin is your doctor or you administer Aspart 20 units at 10 o'clock. Yan, AM. When will be the period of hypoglycemia, or when will the patient experience hypoglycemia? Sige. If you administer Aspart, kailan daw siya mag-hypogly? Mag-hypogly siya, o 10 o'clock nyo binigay, mag-hypogly siya anong oras? Very good. 10:30 to 11 o'clock. O, ganun usually yung tanong. No? Pag nagbigay ka ng gamot na to, kailan magpipeak or kailan yung Tawag niyan, kailan yung kanyang period of hypoglycemia. Hindi masyado nila tinatanong yung duration or onset. Usually, yung peak talaga yung paborito nila. O, sige, you administer NPH, 12 units, at 2 o'clock in the afternoon. Kailan yung peak ng gamot? Between 8 p.m. and 10 p.m. Very good. Kasi magpipeak siya at around 6 to 8 hours. Okay. So, dapat na-memorizing. Okay? So, very good, no? On your own time, no? Memorizing niyo to. No? Paulit-ulit para hindi makakalimutan. Sige, let's talk about your insulin. Yung mga other nursing interventions natin with insulin. Yan. So, insulin, no? The route is subcutaneous but you can give IV, no? Pero kapag nagbibigay ng IV, remember, only the regular can be given, the clear one. Okay? Site natin is taba, 'di ba? Sa subcutaneous. Ano nga ulit yung taba? Ano yung different site natin? Thigh, no? Ano pa? Abdomen, sige. Ano pa yung madaming taba, no? Buttocks, and lastly, your upping. Hindi, arms dapat. Huwag mo ilagay sa upping mo. No? Kahit madaming taba dyan, okay lang yan. Now, for the angle, it's 45 degrees to 90 degrees. 90 degrees kapag obese si patient. 45 degrees for normal weight or lean. Okay. When giving, do not shake or do not give cold because it increases the risk for lipodystrophy or tissue damage of your subcutaneous. What happens is your, tawag yan, subcutaneous tissue hardens, no, tumitigas, so mahirap na siyang itusok. Next, yung ating mga insulin, if it is not yet used, you should keep it at the refrigerator. Once na-open na siya, you can keep it at room temp. When in the refrigerator, it can last for 3 months. Kapag room temp, 1 month lang siya. To warm insulin, no, we roll it between our palms. And when we administer, we have to rotate site. Sige. Pag sinabi nating rotate site, okay, it means that you have to be 2 inches from previous injection site. No? For example, ito yung ating abdomen. Ayan. So if tumusok ka dito, tomorrow, no, dapat 2 inches from that, doon ka naman tutusok. And then the next day, dapat 2 inches from that. The next day, 2 inches from that. So dapat, you have to be 2 inches from the previous injection site. No? Pag sinabi nilang rotate site. Ang pangit ng injection po. Sandali lang. Injection. Okay. Next, it is also important to rotate the area. No? Rotate the area. So when you say you rotate the area, ito yung taba. No? You rotate between thigh, abdomen, buttocks, arm. Okay? So rotate the area every week. So for example, for 1 week, nasa abdomen ka lang. No? After that, lipat ka na naman sa iyong buttocks. Then after that, pwede ka sa iyong thigh. After that, basta rotate area every week. No? Importante yan siya. So this intervention prevents lipodystrophy, no? Or it prevents your subcutaneous tissue from hardening para hindi siya titigas. Okay, next, mixing insulin, no? Kapag nagmi-mix daw ng insulin. So, usually when we mix insulin, we mix your regular and NPH. We mix the cloudy and the clear. No? Mini-mix natin si cloudy and clear. We call that Humulin 70-30. No, Humulin 70-30. 70% would always be your NPH. Whereas the 30% is your regular. Okay? For example, sinabi ni Doc, Bigay ka daw ng Humulin, no? 20 units. Okay? How many units ang NPH? How many units ang regular? Sige. Humulin 20 units. How many units NPH? How many units ang regular? Kung sinabing Humulin 70-30. Okay? Very good, no? 14 units NPH, 6 units regular. So, paano natin nakuha? 20 times 0.7, which is 14. So, 14 units NPH. 20 times 0.3, which is 6 units. Okay? So, sabi ni Doc, administer Humulin, 17 units. Ilan units ang NPH? Ilan units ang regular? Okay, very good. So, usually, i-round off natin to the nearest whole number, no? Kasi walang point-point yung tawag yan sa syringe natin. So, 12 units yung NPH natin and 5 units yung regular. No? 12, 5. Okay? So, ganun ha. Sa Humulin, 70-30 talaga yan siya. Okay, 70-30. Kung hindi naman 70-30, no? Tapos in-indicate mismo ni Doc kung ilan yung gusto niyang NPH, ilan yung gusto niyang regular, then susundin natin yun. No? Susundin natin yun. Pero pag sinabi niyang Humulin 50 units, alam mo na dapat 70-30 yan siya. 70% nandyan, NPH, 30% regular. Okay, so kapag nagmi-mix ng insulin, no, sa isang syringe, di ba? Ano ang gagawin natin? Meron tayong acronym, NRRN. NRRN. Okay, so for example, ito yung ating vial. Okay, this is your NPH and yung kabilang vial would be your regular. Yan. Okay, so NPH regular. Imimix natin sa isang syringe. So, NRRN. First, N. Inject sa N. No? Inject mo sa N. And then, draw air. No? Draw air. So, ang kukunin mo muna, ay ano pala, draw air. You will inject air. No? So, inject air to NPH. After you inject air, wag ka muna kumuha ng any units. Go to your regular. Next, inject air na naman to regular. After that, you start to withdraw the units. So you always draw regular first. You always draw regular first. No? After you have draw regular, go back to N and draw the units of N. Okay, N, R, R, N. Inject air to N, remove. Go to R. Inject air to R, then draw the units. Okay? Go back to N, and then withdraw the units of N. So, N, R, R, N. Okay? Very simple, no? Naiintindihan ba? Yes, no? Very simple. Air mo na sa N, air mo na sa R. Once na sa R ka na, kunin mo na yung units, balik ka sa N, kunin mo yung units ng N. N, R, R, N. Okay? So, what is the most common adverse effect of insulin? Oh, yan, yan. Ano yung pinaka-common adverse effect natin sa insulin? Yes, it's your hypoglycemia. So, that is why it is very important to monitor, tawag yan, to monitor blood sugar, no? Blood sugar prior insulin. So, before ka magbibigay ng insulin, no, check mo muna yung blood sugar niya. Okay? Para okay tayo dyan. And after you have given the insulin, check the blood sugar again, but during the peak. No? So kung anong type ng insulin binigay mo, check mo yung blood sugar niya kapag nag-peak na siya. Okay? And also, part of your nursing interventions is to teach the patient. No? Ano ang symptoms ng hypoglycemia? So once the patient starts to say headache, no, hunger, pallor, yan, pinagpapawisan siya, diaphoresis, ano ang sasabihin mo kay patient? No? Once you feel these symptoms, ano ang first aid ng hypoglycemia? Okay? Simple sugar, juice, candy. Pero gusto ko specific. Gusto ko may milligrams. Dapat take very good, no? Take 15 to 30 milligrams of simple sugar, such as juice, cola, candy. After that, follow it with complex carbohydrates. Okay? Ganun yung kompleto ha. Take 15 to kapag hypoglycemic si patient, take 15 to 30 milligrams of simple sugar. After that, follow it up with complex carbohydrates. No? Ang reason kung bakit kailangan ng complex carbs after doon sa 15 to 30 grams para maintain ang blood sugar niya. No? Kasi pag nagbigay ka lang ng 15 to 30 grams of simple sugar, magsaspike yung blood sugar niya and then babagsak yan ng mas malalim. So dapat 15 to 30, tataas yan siya, then complex carb para maintain mo siya. Okay? So yun yung nursing intervention natin with hypoglycemia. Okay? So other side effects of insulin would be the following, no? Yung somogi, dawn, insulin waning, ganyan. Okay? Hindi ko na masyadong i-discuss to, no? Kasi this is best discussed in endo, no? Endo nursing na. Ang importante lang is yung yung hypoglycemia. But yung somogi effect, yung dawn phenomenon, okay, hindi na yan siya lalabas sa ating pharma exam. Okay. Another important endocrine medication would be your OHAs, no? Yung mga OHA natin. Oral hypoglycemic agents. Okay? So madami tayong OHAs. One by one, i-discuss natin, papag-usapan natin yung side effect and adverse effect. Okay, first natin na OHA would be your oral sulfonylureas. This medication ends with the word amide, or it starts with gly and ends with ide. Tulad ng iyong glipizide. Okay? Glipizide. So, oral sulfonylurea. Its main action is that it increases pancreatic insulin secretion. So, pinapataas niya ang insulin release ng pancreas. Because pancreas increases insulin, what happens? Sugar is absorbed. No? Pag na-absorb si sugar, na may metabolize yun siya, common side effect would be weight gain. But take note, when you mix oral sulfonylurea with alcohol, it gives this disulfiram-like effect or yung parang antabuse na effect. So never mix oral sulfonylureas with alcohol. Okay? Because the patient starts to develop vertigo, dizziness, vomiting, no, mahihilo at masusuka. So for oral sulfonylureas, no alcohol. Next, biguanides. Biguanides, ang medication natin under dyan would be your metformin. Best way to remember, biguanides, yung word na big, ano yung gusto mong malaki? Yung muscles mo, di ba? You want big muscles. No? Yan yung maganda. Because metformin acts on muscle tissue. So, biguanides, metformin. No? Big muscles are meant for me. Metformin. Okay, so metformin, its main effect is that it increases uptake of sugar in your muscles. No? Increase uptake of sugar in your muscles. So, what is the side effect? Weight loss, ang pinaka-common. Because when you take metformin, No, yung carbohydrates, yung sugar na absorb ng muscle, mas bumababa yung timbang mo. And additionally, your muscle size increases. Adverse effect is lactic acidosis. No, lactic acidosis kasi common siya sa muscle. And when muscle metabolizes, di ba, nagkakaroon ng lactic acid formation. That is why, watch out for also nephrotoxicity. Because lactic acidosis can potentiate acute renal failure. And therefore, your nursing interventions with metformin, no? Bawal ang contrast dye. Bawal ang contrast dye because it increases the risk for acute renal failure. If your patient is taking metformin tapos meron siyang contrast dye procedure, for example, CT scan with contrast dye, it is important to stop medication for at least 1 week, no, para hindi magkaroon ng renal problem si patient. Additionally, what is another good thing about metformin is hindi siya nakaka-cause ng hypoglycemia. No, hindi siya nakaka-cause ng hypoglycemia. And that is why metformin is being abused as a performance enhancing drug. No, it is being abused for weight loss. Okay, next. Your alpha glucosidase inhibitor. Gamot natin dyan is acarbose. Acarbose. Alpha acarbose. Okay? So its main effect is it delays carbohydrate absorption in the intestine. So kung delay ang pagka-absorb ng pagkain sa intestine, mas ano talaga common na magbo-bloating ka. That's why the side effect is bloating. An important nursing intervention with acarbose is that you have to give it with meal immediately. Kasi this medication can potentiate hypoglycemia very quickly. No? Nakaka-cause siya ng hypogly ng madalian. So, best way to remember, alpha glucosidase inhibitor, acarbose, A. Diba? Kapag kakain ka, A. So, acarbose, first bite. First bite of the meal. Next. Next, yung ating non-sulfonylurea. Okay, wag mo nang i-memorize yan kasi hindi naman kailangan. Non-sulfonylurea has the same effect as your oral sulfonylurea. Parehas lang, except wala siyang disulfiram effect. No disulfiram effect. Next, yung TCDs natin. This medication is yung ating glitazone. TZD, glitazone. Okay? It decreases basal hepatic glucose. And as we have mentioned earlier, when the medication, ang action niya nasa yung liver, ang side effect niya is, ang adverse effect niya pala is hepatotoxic. That's why you don't give with alcohol. And lastly, your dipeptidase, again, wag mo nang pansinin yan. No? Ito lang tatlo ang pansinin mo. Okay? Any questions? No questions? Sige nga. Ano yung gamot na dapat ibibigay mo with a first bite of the meal? Pagbigay mo, dapat kain agad. Ano yung gamot na yun? It's your acarbose. Very good, no? What OHA should you stop before any contrast dyes? Metformin, correct. Ano yung OHA na nakaka-cause ng disulfiram-like reaction with alcohol? Ano yon? Yung nahihilo ka kapag ininom mo with alcohol, no? Glypeside, yes, or oral sulfonylureas. Okay? The effect of this OHA is in your muscle tissue. It's in your muscle tissue. Metformin. What type of medication is metformin? What is meant for me? Big guanides, because big muscles are meant for me. Okay? Ang glitazone, what is its common adverse effect? Anong common adverse effect ni glitazone? Hepatotoxic, because its action is on the liver. decreases hepatic glucose. No? O next, ang side effect ng OHA na to is bloating. Nagbo-bloating siya. Ano yon? Acarbose pa rin. Okay, acarbose. The side effect of this medication is weight loss. Itong OHA nakakapayat. That's why inaabuso. Metformin. Okay? Sige, very good. Okay, so dagdagan pa natin, no? Yung metformin natin, no, binibigay na to siya sa buntis. Now, previously, what was being taught is that metformin, OHAs are, tawag niyan, are teratogenic. No? Sabi nila lahat ng OHA teratogenic raw. However, no, nagbago na ngayon. No? Metformin can be given for pregnant patients. No? Hindi na siya nakakakos ng teratogen. Okay? Sige, next tayo. No? Again, hindi ko na to i-discuss kasi mas best ma-discuss ang thyroid medication sa endo na. No? For endo. Okay. So before we start with GI system medication, no, break muna tayo. Let's have a 5-minute break kasi medyo madami-dami na din yung napag-usapan natin. Okay? So I'll see you back after 5 minutes. Okay, let's continue with medications affecting the GI system. Okay, next would be your antacids. No? Antacids, common natin na mga antacid, contain your aluminum or magnesium. No? Amphogel and Maalox. Common. Okay? So, this medication decreases stomach acidity because we need it to protect the stomach and the tissue from the acidic environment, usually for patients with GI ulcer, no, gastric ulcer. Okay? It is best given 1 to 3 hours after meal or at bedtime. So the side effect, the most common side effect would depend if ano yung madami. If it is aluminum containing, no? Aluminum, ala, tae. So kung madaming aluminum yung antacid mo, you might start experiencing constipation. Okay? If it is magnesium containing, kapag sobrang daming magnesium naman, you might start experiencing magtae or diarrhea. Okay. So, nursing interventions natin. Antacids may contain sodium. So, for patients who are in mga low sodium na they need low sodium. Now, for example, patients with congestive heart failure, you have to tell them that these medications has a lot of sodium. So, baka delikado sa kanila. They might retain water. Additionally, patients with renal failure or renal problem should also cautiously use this one kasi may sodium. No, they cannot eliminate the excess electrolyte. Next, most antacid, if it is a syrup, are very viscous. So it has to be shaken with 60 ml of water. Okay. Next, caution overuse because when you overuse it, it can lead to rebound hyperacidity. No? So nawawala na yung effect niya. And last, encourage food that is high in calcium and iron. Very important. Because when you decrease stomach acid, yung hydrochloric acid, hindi na-absorb masyado si calcium and iron. No? You need stomach acid to break down calcium and iron to easily, para mas easy yung absorption nila. Without it, calcium and iron are just eliminated in your body. So it's very important to increase calcium and iron in the diet. Okay, so what are the adverse effects naman? No? Common adverse effects nito is kapag sobrang baba ang calcium, sobrang baba ang iron, anong pwedeng mangyari? Di ba? With low calcium, you might start to develop arrhythmias. No? Dahil sa low calcium. Or even, no? Bone dystrophies. Dystrophy. Tulad ng osteoporosis. Low iron naman, you can start developing, no? Anemia. So very important to encourage them eating calcium and iron. Additionally, your amphogel, no? This antacid, yung aluminum hydroxide, no? Amphogel or aluminum hydroxide is also a phosphate binder. No? Phosphate binder. So it increases the elimination of phosphate. That's why it is usually also given to patients with renal condition. Kasi kapag may renal condition yung pasyente, hindi niya nalalabas or they cannot eliminate phosphate properly. So amphogel or calcium citrate, I think, ang binibigay nila. Okay? Any questions with antacids? No questions? Okay, sige, next tayo. Low calcium po due to magnesium? No. Kasi ang ginagawa kasi ng antacid is that it decreases hydrochloric acid. No? It decreases the production of stomach acid. Kapag masyadong mababa yung stomach acid mo, yung mga minerals such as calcium and iron, hindi siya na-break down to be easily absorbed. Kaya nagkakaroon sila ng low calcium or low iron sa kanilang system. Dahil walang chemical, walang hydrochloric acid para i-break down yun siya for easy absorption. Okay, so antacids decrease stomach acid, your hydrochloric acid. No? Without hydrochloric acid, calcium and iron, these minerals cannot be broken down for easier absorption. You need hydrochloric acid to break down calcium and iron to be easily absorbed in your system. So that is why if you take too much antacid, calcium and iron is not absorbed. No, it is just usually eliminated in your system. So one of your nursing intervention is to eat high calcium or high iron diet or increase calcium or iron in their diet. Okay? Any question? No questions? Okay, sige. Let's proceed to your anti-diarrheals. No? Anti-diarrheal. So anti-diarrheal, so from the name, it prevents diarrhea. So mga common natin na gamot would be your motility suppressants such as your loperamide and your enteric bacterial replacement, yung mga lactobacillus natin. Okay? So, when it comes to your motility suppressants or loperamide, its main effect is that it decreases GI motility. How does it do this? Loperamides contain opioids, no? Small or trace amount of opioids. Okay? So, opioids decreases GI motility. And if your GI motility is no, slow, it increases water absorption in your intestine. So it prevents diarrhea from occurring. Like any opioid, one of the common adverse effect of this medication is respiratory depression. And that's why before, loperamide was a controlled substance because it contains opioids. But eventually, they figured out na loperamide does not have that much opioid to cause a problem. No? So that's why it is now over the counter. Pero opioid pa rin siya. It can cause respite depression. It can also cause paralytic ill use. No? It can cause paralytic ill use. So your GI system stops working altogether. No? Your GI system is not moving anymore. Next, for your enteric bacterial replacements or yung mga lactobacillus natin. For example, Persiflora, no? A known ano ba, medication for this one. So, what this medication does is that it decreases pathogenic bacterial growth by increasing normal bacteria. Okay? So, no, it increases the normal bacteria in your GI system, and that normal bacteria will now compete with the pathogenic bacteria with food and ano pa, space, whatever. Eventually, that pathogenic bacteria, no, they don't have any more food kasi kinakain na, no, your ano na lactobacillus is eating it all up, so they die out of starvation. No? So that's how it works. No, they ano ba, they move them out. Okay. So what is the common side effects with enteric bacterial replacement? Abdominal cramps and increased flatulence. No? So in general, when it comes to anti-diarrheal, our nursing intervention is to assess the feces and bowel movement. No? Because it is important to monitor no, changes in their bowel movement or their feces. Is their blood, what is wrong, etc. Okay? Any questions with anti-diarrheals? So, no, very simple lang naman, no? Mga loperamide, mga lactobacillus natin, okay ka ba dyan? Okay? Sige. Another medication would be your anti-secretory agents. No, with anti-secretory agents, they are roughly the same as antacids. Pero pag anti-secretory, no, it prevents the secretion of a lot more chemicals in your stomach. So hindi lang hydrochloric acid, no? It prevents the secretion of intrinsic factor, pepsinogen, hydrochloric acid, no? So madami. Kasi kaya siya tinawag na anti-secretory. Okay? Examples under your anti-secretories would be your H2 antagonist and proton pump inhibitors. H2 antagonists, also known as your tidine. This medication ends with the word tidine, such as your ranitidine. Yan. Okay? Your proton pump inhibitors ends with the word zole. Zole. Tulad ng ating omet, ano ba? Omeprazole. No? Omeprazole. Or pantop. Pantoprazole. Yan. Okay? So main effects nila is that it decreases GI secretion such as your intrinsic factor, uh, such as your hydrochloric acid, your pepsinogen, and a lot more. Pepsinogen. Ano pa? It can also affect part of the pancreas, yung mga amylase, lipase, and trypsin. So it can decrease the secretion of a lot of chemicals in your GI system. So we want these secretions to decrease in patients with peptic ulcer or mga ulcer conditions or mga um, pancreatitis. Pancreatitis. So in peptic ulcer, you want these secretions gone because these secretions can burn the stomach. No? Pancreatitis, it can burn the stomach. For pancreatitis, di ba, they have a lot of amylase, lipase, trypsin. No? And all of these chemicals is caustic. It can burn. No? It can burn tissue. So you give anti-secretory to prevent it from producing more, no, GI secretions. And as usual, no, the common side effect, or should I say adverse side effect, would be no, blood dyscariasis, CNS dysrhythmia. This occurs because of poor absorption, no, poor vitamin or mineral absorption. Pag hindi ka na nag-a-absorb ng iron, no? Because you don't have anything that breaks it down. You start to develop blood dyscariasis such as anemia, diba? Anemia. Oh. If you're not absorbing any magnesium, any calcium, it can affect your brain, diba? Or even vitamin B12. So it might cause CNS disturbance because of decreased vitamin B12, no, magnesium, calcium, which is needed for proper brain functioning. It can also cause dysrhythmias, no? Especially if you cannot absorb any proper calcium in your system. So very important, no, for patients who are taking this for a long time, no, usually mga ICU patients, we have to monitor for signs of anemia, CNS disturbance, dysrhythmia, or even osteoporosis, no, osteoporosis, mga bone problem, bone dystrophy, because this is a sign that minerals, vitamins, no, it is not being absorbed anymore. Another adverse effect commonly associated with your anti-secretory, lalong-lalo na sa proton pump inhibitors natin, would be your Clostridium difficile. Clostridium difficile is an enteric bacterial infection. It means an infection in our intestines. Okay? It usually arises from prolonged antibiotic use or prolonged proton pump inhibitor use. Okay, so what it does is it causes diarrhea. Pero Clostridium difficile is quite dangerous, no? Delikado to siya. Patients who have C. diff are placed under contact precaution because anytime you are in contact with a patient or any of the patient's fomites, you might get the infection. No? So, that is why patients who have C. diff, we have to perform our hand washing with soap and water, okay, because alcohol cannot kill the bacteria. No? When dealing with the surfaces the patient touch, you have to clean it with bleach, no, for the surfaces. And don't forget to wear your gloves and your gown now when dealing with C. diff. Okay? To cure C. diff, meron tayong drug of choice. And the drug of choice would be your vancomycin. This is the drug of choice for Clostridium difficile. Okay? If you can't find vancomycin, metronidazole would be the next best answer. Okay, so what is our nursing intervention with anti-secretory agents? Okay, anti-secretory agents may increase the effect of warfarin. No? It can increase the effect of warfarin, so it can potentiate bleeding if the patient is taking warfarin. Again, it is best given with meals at bedtime, you cannot give it together with antacid. No, don't give, don't give within 1 hour of antacid. Okay, don't give within 1 hour of the antacid therapy. Okay, these medications are usually enteric coated, so do not crush, do not chew the capsule, no? Especially yung PPI. Do not crush, do not chew the capsule. Okay? Any questions with your anti-secretory agents? No questions? No, okay lang? Sige, next na tayo. Sige, let's answer the following. A client has been on long-term therapy of esomeprazole. What is essential for the nurse to ask the client? Number one, are you drinking plenty of water with the medication? Two, are you taking the medication after meals? Three, have you had a bone density test recently? Or four, have you had your blood pressure taken regularly? So if you're taking this medication for a very long time, what should you ask the client? Should ask number three, no? Because esomeprazole, diba? This is an anti-secretory. It can decrease the absorption of calcium, which may cause bone problem, bone dystrophy, abnormalities in our bone. Okay? So our next topic are drugs affecting your renal system. Okay, so mostly diuretics lang i-discuss natin dito, mga different diuretics. Okay? First, potassium wasting and potassium sparing diuretics. So, any diuretics that ends with X, XES, okay, and diuryl, these diuretics are potassium wasting. No? Any diuretics that ends with X or XES, these are potassium wasting diuretics. For example, your Lasix, okay, your Bumex, Clotrix, Esidrex, ano pa, Demadex, and your Diuryl. Okay, all of these are potassium wasting. So when it comes to potassium wasting diuretic, it's very important to monitor potassium. So yun lang. That's the only thing we need to remember. Now when you're giving Lasix, monitor potassium because it can decrease the potassium. Okay, next, thiazide diuretics. When it comes to thiazide diuretic, everything goes down. It can release everything except your sugar, your uric acid, and your calcium. That's why the most common side effect of your thiazide diuretics is renal calculi. No? Kasi tumataas ang calcium sa kidneys, nagre-retain, it becomes a stone. No? So it can cause renal calculi and it can also cause gout. No? Gout. Because uric acid is retained. So that's the most common side effects. No? So everything goes down except sugar, uric acid, and calcium. Next, your osmotic diuretics or your mannitol. No? Yung mga osmotic diuretic natin or mannitol, no? Its main effect is that it removes excess water. It removes excess water in the system. No? So, ano ba ang side effects ng mannitol? The side effects of mannitol is the same as drinking alcohol. No? Mannitol is derived from fermented fruit sugar. No? Diyan kinukuha yung gamot. It's derived from fermented fruit sugar. So the effect of mannitol is the same effect as being drunk, no? Or drinking alcohol. Okay? So you start urinating out. You keep urinating. And when you're drinking alcohol, no, pag umiihi ka, you are just urinating water. You're not urinating much of the electrolytes. Now, you're retaining that, but you are urinating a lot of water. That's why they call it osmotic diuretic because water lang yung lahat yung nilalabas niya. And therefore, your nursing intervention is to assess for fluid electrolyte imbalances, no, because it can cause increased concentration of electrolytes. For example, hypernatremia. No, it can cause hypernatremia, and also monitor for fluid imbalance because you are just urinating a lot of diluted water, no, urine. Next, check the vital signs, okay, because you are trying to watch out for any signs of hypotension. Yan. Kasi kaya niyang pababain, no, it can decrease your blood volume. Okay? Next, it is best given in the morning. So the reason for this one, it's because we don't want to disrupt the sleep. No, yan lang yung rason. We give it in the morning so they don't keep waking up and urinating. No, and then tulog na naman. Next, change the position slowly. And it can also cause headache din pala, di ba? When you drink alcohol, no, ihi ka, tapos sumasakit yung ulo mo. The reason why you are having a headache, it's because of, your brain tissue is dehydrated. It has the same effect, no? It has the same effect. Mannitol causes the tissue of your brain to become dehydrated. So you start having a headache and orthostatic hypotension din. So yan lang yung minomonitor natin. And of course, when you're giving this medication, monitor the urine output. No? Mannitol is the drug of choice for increased ICP. Okay? Because in increased ICP, you want to remove as much water inside the brain, inside the head. No? So it can decrease ICP as fast as possible. Okay? Any questions with your diuretics? Any questions with your diuretics? No questions? Okay, sige. Our next would be your antibiotics, anti-infective agents. Okay, because there is a lot of antibiotics, we will discuss the most tested antibiotic or the most commonly asked antibiotic. And ano tong antibiotic na to? It would be your aminoglycoside. So let's put a star on that one. So 8 na yung na-discuss natin. Dalawa na lang ang kailangan. No? Aminoglycosides, these medications ends with the word mycin. Mycin. Tulad ng iyong vancomycin, no? Streptomycin, bleomycin. So it ends with the word mycin. Yan. So, aminoglycosides are considered as broad-spectrum antibiotics, no, because it can be used for any types of infection. However, ang special sa kanya is that aminoglycosides can be broad-spectrum, it can also be specific, no? It can also be specific. For example, streptomycin is for tuberculosis, di ba? Mycobacterium tuberculosis. So, usually, when a mycin is being prescribed, no, it means nothing has worked. No, nothing has worked. This patient has a very resistant bacteria or, no, there is terrible infection going on. So that's why they start giving a mycin, no? So, the reason why they're giving this one the least, no, ito na yung last case scenario, it's because aminoglycosides are unsafe. Delikado to ng mga gamot, no? Delikado siya ng mga gamot. So, what are the indications for aminoglycoside or yung mga mycin natin? It can treat TB, septic shock, and septic peritonitis. Septic peritonitis, septic shock, Clostridium difficile, no? Mga major burns. So if you have burns that covers greater than 80% of your body, bibigyan ka na ng aminoglycoside. Yan. So isipin mo yung mga very delikado na ng mga infection, no? Very dangerous forms of infection. Okay? So, aminoglycosides, they are usually given parenteral, no? Parenteral. Binibigay natin siya IM or IV most of the time. When we are giving this medication, there are two things that we have to watch out for because this is the common adverse effect. No? We are watching for nephrotoxicity, and ototoxicity. How do we best remember this? From the name itself, no? Mycin. It sounds like mice, di ba? Mycin, mice. And what do you see in a mice? Big ears, no? And these big ears will help you remember ototoxicity. Okay? So tignan mo yung ear. It looks like a kidney. We have two ears, we have two kidneys. So it is ototoxic and nephrotoxic. No? It can damage your cranial nerve number 8. O, tignan mo si number 8. Baliktarin mo lang si number 8. Put a head, some whiskers, a face. Looks like a mice. Mycin. No? So, ototoxic and nephrotoxic. Yan. Okay? So that's why it's very important that we monitor renal function tests. We monitor the trough and peak levels when you are giving mycins parenteral. Okay? If the patient starts to say there is ringing in my ears, that could be a sign of tawag yan, aminoglycoside poisoning na. Okay? Next. So, as I've said earlier, diba, we give this one parenteral, but not all the time. We also give mycin oral. Pero usually, hindi masyado to common. The common oral mycins would be your neomycin and your kanamycin. Neomycin and kanamycin. Okay? Maybe you have heard this medication before. Diba? Anong condition? Narinig nyo na si neomycin. Cancer. It's liver cirrhosis, di ba? Hepatic enceph, yes, no? Kapag may liver cirrhosis si patient, pag may hepatic enceph siya, we usually give neomycin or kanamycin. So why do we give these mycins orally? It's because, again, this medication is very dangerous, no? It can kill all your bacteria. Kaya niyang patayin lahat. It can kill your abnormal bacteria and it can also kill normal bacteria. So we give neomycin to kill E. coli. No? E. coli is a normal gut flora. No? Nandyan talaga yan siya. Mainstay natin yan. The function of E. coli is that it metabolizes nitrogen to become ammonia. No? Metabolizes nitrogen to become ammonia. Ammonia is then metabolized in your liver to become urea, wherein it is easier expelled through urination. So si E. coli, it creates ammonia. It creates ammonia. So the way it creates ammonia is through metabolizing nitrogen, from protein. So a patient with liver cirrhosis cannot convert ammonia to urea. And therefore, ammonia is retained in their system. At delikado yan. So to prevent increase in ammonia, we have to kill the factory of your ammonia. So kill E. coli decreases ammonia. Decrease in ammonia, decrease hepatic encephalopathy. Yan. So para hindi magkakaroon ng hepatic enceph ang liver cirrhosis. Additionally, we also give neomycin and kanamycin orally to sterilize the bowel. For example, the doctor wants a very sterile bowel for surgery. No? So to sterilize the bowel, this medication is given because it can kill all the bacteria inside that bowel, inside your intestine. Or OR. Okay? Any questions with your aminoglycosides, your mycins? No question? Okay. So, tatandaan ha, thromycin and mycin are different. Iba si azithromycin, clarithromycin, no? Erythromycin. Thromycin yan sila. They are different sa yung aminoglycoside which just ends with the word mycin. No? In fact, aminoglycosides are so tough that you can even use this medication to treat cancer. No? Because it can kill normal cells. It can kill normal tissue as well. Okay? So, our next medication, another anti-infective would be your antimicrobacterial or yung mga TB meds natin. Okay? When it comes to TB meds, we have to remember the treatment. The treatment for TB would be 16 to 13 months, 6 to 13 months. So minimum of 6 months, greater of maximum of 13. When you take the medication, continuously for 2 to 3 weeks, you become non-contagious. So it would take 2 to 3 weeks before you start being contagious again. Ay, before, ay, you take it 2 to 3 weeks and you become non-contagious. Sorry, no, when it comes to TB. So medications under your anti-TB meds would be your rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. You're already familiar with this medication. Pretty sure you have heard it 1,000 times, diba? Yung RIPES natin. So it's very important to remember the side effects and adverse effect. For rifampicin, the side effect is red-orange urine. Pero urine lang ba ang nagdi-discolor? Is urine the only discoloration in your rifampicin? No, no? So all body fluids, tama, all body fluids, your sweat, no? Your tears, okay? Even, no, ang iyong defecation. So this is discoloration of all body fluids, no, all secretions natin. And therefore, it's very important that one of your nursing intervention is that if the patient has a contact lens and he's taking RIPES medication, no? Remove the contact lenses muna because the contact lens will start to discolor orange. So, the red-orange urine, is this a side effect or an adverse effect of the medication? It is a side effect. So, which means we do not discontinue. Okay, next. For isoniazid, it can cause peripheral neuritis or pins and needles. Now, pins and needles. So the reason for this one, it's because of vitamin B6 deficiency. So our nursing intervention is to increase vitamin B6 in their diet. Now, increase vitamin B6 in diet. For pyrazinamide, the most common side effect is hyperuricemia. Hepatotoxicity is an adverse effect of the medication. So hyperuricemia, which means increase in uric acid. That's why pyrazinamide can cause gouty arthritis. No? It's a side effect. So to prevent gouty arthritis, our nursing intervention is to increase oral fluid intake, OFI, to continuously eliminate excess urea. Next, ethambutol, no, causes optic neuritis. Is this a side effect or an adverse effect? Ang optic neuritis. It's an adverse effect. Okay, it's an adverse effect. Therefore, no, when a patient starts to say there is blurry vision, no, or decrease in visual acuity, you have to tell the patient to talk to the physician immediately, no, because they have to stop the medication. If the patient continues to take ethambutol, he will be blind, no? Nakakabulag to siya. Okay? So optic neuritis when it comes to ethambutol starts with a blurry vision and eventually they start to develop a red or green color discoloration. Discoloration. So when they look at red, it looks like brown, no? Or when they look at red, yeah, it looks brown. Kapag green, iba din yung color niya. So there is red-green discoloration. Yan, so it is an adverse effect. And lastly, your streptomycin, it is nephrotoxic and ototoxic. What cranial nerve again is damaged sa ating streptomycin? Cranial nerve number 8. Very good. Okay? So we are not yet done, no? We are not yet done kasi 'di ba? Meron tayong top 10 most tested question. We have 2 more topics. Oh no. Oh yes, we have another topic discussing the 9th. Okay? So any questions so far? Any questions so far? No questions? Okay, sige, let's answer this one before we move to the next topic. A patient with latent tuberculosis is having a teaching session with a new graduate nurse. Which statement by the new graduate nurse should be corrected by the charge nurse? So when you say it should be corrected, no, ibig sabihin, what they are teaching is wrong, no, false. So you are looking for false statements. Select all that apply. Number one, take prescribed isoniazid religiously for 9 months. Is this a true or a false statement? This one is a true statement. Very good. Diba? Because you can take the medication for 6 to 13 months. Ibig sabihin, 9 months is in between that. Okay? As long as you don't take it less than 6 or greater than 13. Okay, next. A sputum culture is not necessary when medication therapy is initiated. Is this a true or a false statement? This one is a false statement. Sputum culture is needed to determine the progress of the patient's condition. Number three, false negative result in tuberculin skin test is common to immunosuppress. True or false statement? This one is a false statement, di ba? Dapat false positive. Okay? False positive yung common sa kanila. Because if you are immunosuppressed, you need to have a wheal of 5 millimeter to be considered positive for TB. So for PPD pala ito na, PPD, purified protein derivative. Okay? After that, no, nagpapas, sputum culture and exam sila, and they notice that wala palang TB si patient. That's why common sa kanila ang false positive. Kasi yung wheal, 5 millimeters lang dapat sa kanila. Okay? What about for normal individuals? What is the wheal size? Answer is sa US. Sa US tayo, US standards. It's 15. Okay? 15 millimeters. No, this is for US standards. Okay? 10 millimeters, no, is considered for areas with endemic TB, such as Philippines, India, ano ba, Japan, yan, mga endemic TB countries yan, or those who are working in an tawag yan, working in a high-risk environment. For example, you work in a lab that deals with TB most of the time. Okay? But for anyone who is healthy, no, tapos hindi nanggaling sa endemic country, 15 millimeters yung ginagamit. Okay, next. Cover the mouth and nose when coughing and put the used tissue into paper bags. Is this a true or a false statement? It is a false statement. What makes it false? Ayun, paper bags, di ba? Have you tried spitting on a paper bag? Ano mangyayari doon sa paper bag na yun? Diba? Mabumutas lang. Tapos, squishy na siya. Puno na ng plema. Ugh. So, asan ba dapat tinatapon? Where should you throw it? This coughing, plastic. Okay? Yellow plastic. Yun. No? Yung mga infectious disease natin na colors. Yellow plastic. Next. It is unlikely that you will be infectious after a week of anti-tuberculosis drug treatment. Is this a true or a false statement? This one is a false statement. What makes it false? Bakit siya false? A week. Okay. How long do you take it? Para considered ka na 2 to 3 weeks. Take it for 2 to 3 weeks to be considered non-infectious. Very good. Okay? Sige. So, for a while lang ha. So, our next topic, no, para ma-complete natin yung top 10 most tested questions, sure value, would be your antipsychotic medications. And that would be the 9. Okay? Yun na yung 9. Yan. Okay? Sige. So, recap muna tayo sa lahat ng natutunan natin, no? So, ano yung top ano ba? Top 10 most tested drugs natin, no? In no order, no? Hindi to siya in order. First would be your pain meds. Again, hindi to siya in order ha. Ito yung na-discuss natin, pain meds. Second would be your beta blockers. Third would be your calcium channel blockers. Fourth, digoxin or digitalis. Fifth, ano ba yung fifth? Um, Anticoagulants such as your heparin and warfarin. Yan yung paborito nila. Six would be your corticosteroids. Okay. Eight, insulin. Nine is psychopharma medication. No? Psychopharma. So, nandito na yung mga antipsychotics, anticholinergics. Uy, 7. Wala akong 7. Ano ba yung 7 ko? Pain meds, beta blockers, calcium channel blockers, anticoagulants, aminoglycosides. Okay, wala pa pala tayo, no? So, ayan, 7 would be your aminoglycosides. Okay, yung mga mycin. 9 would be your psychopharm, yung i-discuss natin ngayon, which would um, encapsulate your antipsychotics, your anticholinergics, kasi anticholinergic, we usually use that for antipsychotics din, ay, for treatment of antipsychotics, your antidepressants, and your mood stabilizers. No? So, nandyan mostly. And yung 10th would be OB meds. So, si number 10, hindi natin i-discuss because it should be discussed in your OB nursing. Plus, madali lang man si OB meds because it is just divided into two. Oxytocin, and tocolytics. Diba? One that makes the contraction harder, one that prevents the contraction. Okay? So far, ito yung top 10 most tested questions in NCLEX. Most tested drugs in NCLEX. Okay, ito. So if you are not good with pharma, no? You don't need to memorize everything. Just memorize the following. Ito. Yung mga most tested questions. Okay? So let's start with your psychopharma. No? So psychopharma is a long topic. Okay, so I don't want to start immediately. Let's have our last 5-minute break, and then after that, we will discuss all the psych meds. Okay? Para hindi tayo maging psych patients. No, may handouts ba? Oo, may handouts nito, pero sa psych ko binibigay. Pero this one, no, makinig lang kayo. No, just listen. Or if you want to write, then write. Okay? So, ang handouts nito is sa psych na kasi. Itong psychopharma na discussion natin, mabilisan lang to, no? Yung mga need to know basis natin when it comes to psych medications. Okay? Yung psychopharm natin during psych, no, mas ano yun siya, mas in-depth yun siya. Okay? Sige. So see you back after 5 minutes. Okay, sige. Patuloy tayo. So this would be our last topic for today. And tomorrow, exam lang. No? Exam lang tayo bukas. So first would be antipsychotic medications. No? Antipsychotic medication. Antipsychotic medications, okay, take note mga other names niya. No? Paborito ng NCLEX, they like to use different names to mean something else. Now, for example, antipsychotics are also known as your neuroleptics. No? Also known as your major tranquilizers. Okay? Neuroleptics, major tranquilizers, it's the same. Antipsychotic pa rin yan. Main effect niya, it decreases dopamine. It decreases dopamine. Okay? So, antipsychotics are divided into two. You have your typical and atypical. Again, take note of the different names. Traditional and conventional, these are the same as your typical antipsychotics. Typical, mas maganda siyang i-treat for positive symptoms. For atypical, positive and negative, but mostly sa negative. In this discussion, we will focus mostly on the side effect and adverse effect of this medication. So, ang typical antipsychotics have more EPS side effects, no? Extrapyramidal symptom side effects. Okay? And also, meron din silang anticholinergic side effects. O, tatandaan ha, antipsychotics can show EPS and anticholinergic side effects. What are your anticholinergic side effects? Can't. Oh, can't. Okay? So, meron tayong isang nurse dito na ano na sobrahan na ng knowledge. Okay? Can't. Ayun. Can't. Okay? Next. Ang atypical naman natin, dyslexia na. No? Sobrang daming information na kasi, sir, kung ano-ano na lang pinagsasabi mo dyan. Okay? Huwag ka mag-alala. Marami pa tayong information na idadagdag. Okay? So, ang atypical natin, no? It has decreased risk for EPS, pero pwede pa rin ha, pwede pa rin. And minimal risk for anticholinergic. So kukunti lang pala yung risk nila for these side effects. So let's meet these medications. Okay? Who are these medications? For your typical antipsychotics, they are divided into high and low potency. Okay? High potency, typical antipsychotics, meron kang prohanastella. Prohanastella. Prolixin, Haldol, Navaid, Stelazine. Sa moderate, meron kang Lomotril, Lositane, Moban, Trilafon. Sa low potency, Tosetame, Thorazine, Serentil, Taractan, Melaril. Oh. So, in your own free time, paulit-ulit mo itong i-memorize. No? Ulit-ulit mo yung sasabihin para hindi mo makalimutan. Say it out loud while nakaupo ka sa public, while nakasakay ka sa jeep, nakasakay sa bus or sa train. Para isipin ng tao, psychotic ka na din. Prohanastella, Lomotril, Tosetame. O, ulit-ulit ka. Diba? So, keep repeating it para ma-remember. Now, ang atypical, madali lang ang atypical, no? Kasi, sorry, kakulangan pa lang po siya. No? What we need to memorize for atypical is chlorisol. Chlorisol. Clozaril, tinatawag din nila as clozapine. No? Huwag mong makakalimutan, parehas lang yan. Risperidal or risperidone, parehas lang yan. And olanzapine. Chlorisol. Clozaril, risperidal, olanzapine. Okay? So these are the most common antipsychotics that may come out sa ating sa NCLEX natin. Okay? So, we mentioned EPS, extrapyramidal symptoms. EPS is a side effect of antipsychotic medications. Lumalabas to siya kasi sobrang baba na ng dopamine. Sobrang baba ng dopamine. That's why they start to show these types of symptoms. Let's meet the different EPS. No? First natin na EPS would be your acute dystonia. Okay? Acute dystonia. Acute dystonia, is muscle rigidity in different parts of your body. It can affect, no, this muscle rigidity can affect your neck, no, pwede ka magkaroon ng torticollis or tinatawag nilang stiff neck. Okay? It can affect the muscles of your eyes, no, or your oculogyric crisis, oculogyric crisis. Yan, it can affect the muscle of your eyes. So look up lang siya always. It can affect the muscles of your hand, writer's clamp, no? Stiff yung hand mo. It can affect the muscles of your throat, which can cause laryngeal pharyngeal spasms, which can be dangerous. Delikado to siya. Kasi pwedeng mag-close yung airway. It can even affect the muscles of your back, causing this opistotonus or arcing of the back. So, acute dystonia can affect different muscles, no? Kahit anong muscle, basta may muscle, it can make it stiff. So what is your intervention? Administer your anticholinergic medication. Cogentin or benztropine, isa sa mga binibigay natin. Anticholinergic medications, ano ginagawa niya? Diba? It decreases acetylcholine, which in turn increases dopamine, which counteracts the effect of EPS, kaya siya nawawala. Diphenhydramine is another anticholinergic, no? Pwede din siyang ibigay. And lastly, stay with the client because acute dystonia is both painful, kasi parang may cramps ka, no, na hindi nawawala, and frightening. No? Nakakatakot because they don't know why this is happening. Okay? So that's for your acute dystonia. Okay? Sige, screen cap na. Next slide na tayo. 1, 2, 3. So another EPS would be your pseudo-Parkinsonism. So pseudo means parang, no? Like Parkinson. Okay, so bakit nagkakaroon ng pseudo-Parkinsonism si patient? It's because, again, the antipsychotic medication decreases dopamine. It commonly affects those who are dehydrated, elderly, and female patients. Okay, sweaty old ladies. Signs and symptoms niya is parang Parkinson. So, no, bradykinesia, Parkinsonian gait, pill rolling, hand tremors, rigidity, all the symptoms of Parkinson nakikita mo sa pseudo-Parkinsonism. So what is our nursing intervention? Well, doctors can change the antipsychotic, no, pwedeng baguhin. Or you can administer your anticholinergic again. That is why, no, anticholinergics and antipsychotics belong to psychopharma. Kasi most treatment for EPS is an anticholinergic medication. Okay? Anticholinergics such as your amantadine can reverse, no, the EPS by increasing dopamine in your system. Next, akathisia. Akathisia is the most common EPS. When you hear this word akathisia, think of restlessness. It's the same thing. Or agitation. Agitation. So if you have akathisia, you are also restless and agitated. Again, most common EPS. No? And this is the reason why sometimes psych patients, lalong-lalo na yung mga psychotic patients natin, mga schizophrenic, they stop taking the medication altogether because they cannot take this form of EPS. They cannot take being anxious, restless all the time. So what is our nursing intervention for this one? Doctors can change the medication, no, baguhin yung antipsychotic. We can also give beta blockers because beta blockers has a sedating effect, di ba? Beta blockers has a sedating effect. It can decrease heart rate and it can also decrease blood pressure. Okay, decrease heart rate, decrease PP, sedated ka. Or, no, you can also give your anticholinergic para balance ang dopamine. Balance the dopamine in your system. Yan. Okay? So that's for pseudo-Parkinsonism and akathisia. Okay na tayo? Okay, next slide. 1, 2, 3. Okay. Next would be your tardive dyskinesia. Now, tardive dyskinesia, the problem with this one is this EPS, no? Aside na late appearing siya, irreversible. Once you have this one, it will never go away. Unless, of course, you stop medication. Now, you stop the antipsychotic. It is irreversible. It is manifested by stereotype movements such as the following. Ayan, yan yung mga stereotype movement natin. Okay? This stereotype movement is unconscious. So, hindi nila napapansin that they are doing this one. Okay? So, tardive dyskinesia, it usually stops when they are asleep. But when they are awake, it comes back. Antipsychotics would be stopped kasi this is the only way to stop tardive dyskinesia. They can decrease the dose or change medication, or they can administer another medication, your valbenazine. Okay? Valbenazine is a good drug of choice for tardive dyskinesia. It can prevent these tics tardive dyskinesia has. And your last EPS would be your neuroleptic malignant syndrome. This is the most lethal EPS. No? So when you encounter this EPS, report to the physician immediately. Neuroleptic malignant syndrome is manifested by fever, muscle rigidity. Sabay to sila. Fever and muscle rigidity. Aside from that, usually you would notice everything is increasing. The heart rate, the RR, the BP, the level of consciousness, lahat tumataas. No? Lahat tumataas, even the temperature. No? Without proper treatment, okay, so, sorry, tanggalin ko yan. Without proper treatment, the patient here will expire. And usually what kills the patient is the fever. So that's why your intervention is to, number one, discontinue all the drugs. Discontinue all medication. Next, treat the fever as fast as possible. No? Lower the fever. Okay, to lower the fever, use your external cooling measures. Next, no? After you treat the fever, usually the patient here is for ICU na. Once nasa ICU si patient, no? Benzodiazepine or sedatives are given to decrease muscle rigidity. Okay? And lastly, monitor for signs of rhabdomyolysis. Okay? So, pwedeng magka-rhabdo si patient dito because all the muscles are stiffening, no? They are contracting, which can lead to muscle tissue death. No? So, monitor the urine, no? Pansinin mo yung ihi niya, may nagbago ba, etc. Okay? Ang tinatamaan ng NMS, yung mga patient na underweight, no? Payat. Poor nutrition. No? Nutrition. Okay? Yung mga patient na, no, masyadong mataas yung dosage ng antipsychotic nila. High dosages of antipsychotic. Ayan. Ito yung mga tinatamaan. Okay? Any question with your EPS? Again, EPS is a side effect, no? So all of the EPS are ang valbenazine is a drug of choice for tardive dyskinesia. No? Isa siya sa mga medication that could actually stop the tics, no? Or control it. Okay? So again, ang EPS side effects lang to sila. So pag sinabi natin side effect, okay, we will expect this one. Except your NMS. NMS is the only EPS that is lethal and should not be expected. Okay? So other side effects related to your antipsychotics are the following. So ito yung mga other side effects natin. We have sedation. Kasi, di ba, ang tawag natin sa antipsychotics are major tranquilizers. So from the name, tranquilizers, nakakaantok. It can cause atropine psychosis. Okay? So atropine psychosis is manifested by your skin is kind of red, no? Your skin is also dry. Yan. Next, photosensitivity. No? Common siya with antipsychotics. So it's very important to wear your sunglasses, your long sleeves, your wide hats, ganyan. Anticholinergics, yes, Common din yan. Agranulocytosis. Now, this one is an adverse effect, usually related to clozaril or clozapine. No? Clozapine. Pag masyadong mataas, when clozaril is given at a higher dosage, it can cause agranulocytosis. So when the patient is taking clozaril, watch out for signs of infection. Seizure, another adverse effect related to clozaril. Again, the seizure here is related to the dosage of clozaril or clozapine. The higher the dosage, the more likely magsi-seizure si patient. Orthostatic hypotension dahil sa anticholinergic niya na side effect, and hormonal effects. No? Hormonal effects because it can mask, no? It can mask impotency. Okay? Pero yung impotency nila for both male and female, usually mabilisan lang. After a week, nawawala. No? Nawawala na yung impotency nila. Okay? So these are just uncommon other side effects ng antipsychotics natin. Okay, any questions? Any questions? No questions? Sige, let's answer the following. Ayan, no? Click to highlight the findings that reflect client's understanding of his medication and condition, no? Dapat yung mga statements means that the patient understands his medication and his condition. Okay, next. At Redwood National Park at 0900, male, 27-year-old, admitted to the psych ward after a brief psychotic episode. Diagnosed with schizophrenia. Client was prescribed with prolixin to treat positive symptoms and clozaril for negative symptoms. Client was observed to be stretching his muscles, stating, number 1, that he is watching out for muscle stiffness and fever and to report to the HCP if any symptoms show. The statement 1 show understanding to the medication or condition. Answer is yes. So number 1, understanding yan. Okay? Sige. Number 2, client added that he felt symptoms of stiff neck, backaches, and hand spasm, stating they are signs of NMS. Is number 2 shows understanding? No, no? Ano tong na-feel ni patient? Itong mga stiff neck, backaches, hand spasm. We call this one as your acute dystonia. Very good. Okay, next. 3. Client states that the akathisia has now disappeared, stating that it was a sign of neuroleptic medication effectivity. Does number 3 reflect understanding to the statement? No. Because no, it doesn't mean na kapag nawala ang akathisia mo, effective yung medication. Diba? Akathisia is just a side effect. To know if the medication is effective, dapat mawawala yung symptoms of psychosis. Okay, next. During period of outdoor activities, client was observed to be participating with other clients well. Number 4, client was observed to be wearing sunglasses during activities. Does that reflect understanding? Yes, because antipsychotic medications can cause photosensitivity. Correct. During lunch, UAP reported to the nurse that number 5, the client ate 2 pieces of fried chicken, 4 strips of bacon, mashed potato, and bread pudding. Does number 5 reflect understanding of the condition? Answer is no. Because the client, di ba, alam natin that antipsychotic medications causes an anticholinergic side effect, which is your can't. No? If you can't shit, what should you be eating? You'll be eating fried chicken, bacon, etc. You'll be eating high fiber. So mali si number 4. Ay, mali si number 5. Eh, dapat high fiber kinain niya. Later, number 6, the client was seen sucking on ice and chewing sugarless gum. Does number 6 reflect understanding? Yes. Bakit? Why does that reflect understanding? Can't spit. Yan. Very good. Because of can't spit. Okay. North Haven Rehab Center. Upon returning, number 7, the client visited the nurse's station stating a station after taking a short nap stating that he has sore throat and dry cough. Is that correct? Does that reflect understanding? Number 7, yes. Bakit? Why does that reflect understanding? Agranulocytosis. No? Agranulocytosis, what medication is the patient taking that might cause that? What medication was the patient taking? It's the clozaril. Very good. Okay? Very good. Okay, next. Antidepressants na naman tayo. No? Ang antidepressants natin are divided into first line, second line, and third line. First line, second line, and third line. Okay? First line antidepressants, these are the best. No? The best. So when you say the best, wait for a while lang. Kailangan ko na mag-charge. Mabilisan lang. Okay, sorry. So, if they are the best, it means na the patient can take this one at home. Take home to siya. No? SSRIs can be taken at home. Next, second line natin, TCAs, they are not the best but they are not the worst. Because if you have been prescribed with a TCA, no, you should be hospitalized, or if you're taking it at home, you have to be monitored, no, by a home health nurse. So a home health nurse should be visiting you, no, monitoring your dosage of TCA. Next, third line. This is the worst. No, mga MAUIs natin, monoamine oxidase inhibitor. Because if you are taking a MAUI, you have to be hospitalized. No chance of going home. So among the following, SSRI, TCA, MAUI, which one can you discharge? Sino ang pwede mong ma-discharge? Your first lines or your SSRIs. Very good, no? SSRI kasi pwede nilang ma-take at home. Okay, so let's meet these medications. First, si Maui, di ba? So I think you're familiar with Maui, yung Disney, no? Anong sabi ni Maui doon sa Disney? What can I say except you're welcome? Bakit siya nagwi-welcome? Because Maui has a lot of pamana para sa atin. Marami daw siyang parnate, marpan, at nardil. Pamana. Next, TCAs. TCAs, to, Noel, C. To, Noel, C. Tofranil, nortriptyline, elavil, sinequan. And last, your SSRI, very simple, Prozopa. Prozopa, Prozac, Zoloft, Paxil. Okay? So, again, in your own time, memorize these commonly tested antidepressants. Say it out loud, no? Say it while you're while you're shopping, no? Out loud. Okay? Para marinig nila na nagme-memorize ka. Okay? So, let's first talk about your SSRIs, the best. This is the best because you can take it at home. It has few side effects. Okay? So, what are the side effects? Diretso tayo sa side effects. This is what is commonly questioned, no, side effect. The most common side effects of your SSRI would be mga GI symptoms, no? Mild abdominal pain. Yan. Mild abdominal pain. Usually manifested by nausea. Medyo nasusuka, nahihilo. Pero mild lang. It can also cause mild akathisia. Tandaan mo ha, mild lang lahat. When you say akathisia, I mean agitation. No? Agitation. It can also cause mild insomnia. Again, they are all mild. No? Gusto ko yan siya i-diin. Okay. Uncommon naman. Uncommon side effects of your SSRIs are decrease in libido. No, decrease in libido. So, impotence, ejaculatory delay, okay, decrease orgasm, yan. Okay, decrease in libido. Hyponatremia is a common side effect commonly associated to your elderly. No? Kapag mga elderly, hyponatremia. The akathisia can be treated with propranolol, a beta blocker, or a benzodiazepine, no? Your anxiolytic. Yan. Okay? So, when it comes to SSRI, hindi maganda to stop it. You should not abruptly stop SSRI because it can cause SSRI withdrawal. SSRI is generally a downer. So if you are withdrawing from an SSRI, what would you expect for the signs and symptoms to be? Everything is increasing. Lahat tumataas. Okay? Lahat tumataas. An important thing to understand when it comes to um, SSRIs is that yung tinatawag nating serotonin syndrome. So what is serotonin syndrome? This is when you mix SSRI plus another antidepressant or any tryptophan containing uh, supplement, no, such as your St. John's wort. When you mix this one, you get a fatal interaction, no, serotonin syndrome. Manifestation nito is everything is increasing. And when I say everything, I mean everything. The temperature, the heart rate, the RR, the BP, the muscle spasms, no, the deep tendon reflexes, lahat tumataas. Okay? And that is why the most common end result for this one is seizure, followed by coma, and then death. No? Everything is going up. So your treatment for this is to, number one, monitor vital signs. Now, you have to monitor vital signs. Very important because increasing vital signs would mean na could be SSRI problem. Next, aside from that, no, discontinue, okay, discontinue offending agent. Okay, for example, if the patient took St. John's wort, no, yung tryptophan containing supplement, just discontinue it as fast as possible. The symptom will resolve within 24 hours. And lastly, no, monitor for signs, monitor the renal and liver function for your SSRI. No, not just for SSRI, sa lahat actually ng maintenance medication mo. If you're taking maintenance medication, dapat minomonitor ang renal and liver. No? So serotonin syndrome, it cannot cause, SSRIs pala, sorry, SSRIs cannot cause sedation. Now that's another good thing about it. It cannot make you fall asleep. Okay? Sige. Next na tayo. Screen cap na. 1, 2, 3. Okay. Next would be your TCAs. No, not the best, but not the worst. Okay. So TCAs, no, they are divided into two. You have your secondary amine, you have your tertiary amine. Don't bother yourself with this one. No, wag mo nang kailangan, hindi to siya kailangan i-memorize. Secondary amine means that it is active. The antidepressant can be activating. No? Tertiary amine, the antidepressant can be sedating. That's the only thing you need to know. TCAs can wake you up or can put you to sleep. It depends on the type of TCA they are trying to give. Okay? Focus on the side effects, however. The most common side effect, no? The most common side effect, wag mo nang pansinin lahat ng nakasulat dyan, is anticholinergic, no? Side effect plus sedation. Yan. That's the fastest way to remember it. Okay? Don't focus so much on this big text here. No? When we are going to discuss psych, and hopefully ako sana yung psych nyo, then we will discuss all of this information. But if you need to remember TCA, just remember the common side effect is anticholinergic side effects or Kent plus sedation. So nakakaantok siya. Okay? Another problem with TCA, ang adverse effect niya is toxic level. TCAs can induce a toxic level. So the toxic level of TCAs is that it can cause sedation, respite depression pag sobrang dami, and convulsion coma. So respite depression is common kapag sedating yung TCA mo or tertiary. Convulsion naman kapag activating yung TCA mo. So depende sa type. Pero tatandaan mo lang ito, no? Lagyan ko 'yan ng box. Okay? And may mga star, no, para hindi mo makalimutan. Ayan. So to treat this toxic effect, they just they perform gastric lavage. Ayan. Gastric lavage to pump it all out. No? After that, after gastric lavage, pwede din activated charcoal. Activated charcoal. Okay? So yan. Basta tatandaan ha, TCA, anticholinergic side effect, and sedation. Pinaka-common side effect. Adverse effect niya is respite depression or convulsion. No? Respite depression or convulsion. Okay. So very simple, very easy to remember. Next, Maui na tayo. Okay? 1, 2, 3. Ayan. So madaming na naman nakasulat, di ba? Nakakapagod. So best way to remember Maui, it is the worst because it interacts with a lot of medication. No? It interacts with the following. Interacts with the following. So, if you were listening sa second day natin, ano yung type ng medication ang bawal sa Maui? Kung nakikinig kayo, ano yun? Starts with letter P. Ayun, decongestants or ano yun? Decongestant or phenyl, di ba? Phenyl-containing medications. Phenylephrine, phenylpropylene, etc. No? So, bawal sa Maui. Aside from that, any form of stimulants, you cannot take it with Maui. Okay? Stimulants such as epinephrine, pseudoephedrine, no? Bawal. Okay? Ano pa? Anti-hypertensive medication such as your ACE and your ARBs, bawal sa Maui. No? And madami pa, no? Sympathomimetic medications, dextromethorphan, metforphan, yan, madami. And that is why when a patient is taking Maui, they have to be hospitalized because you have to monitor all of the medications that is interacting with Maui. Okay? Aside from this drug interaction, there are also a type of food that you cannot eat when you're taking Maui. And this food contains tyramine, correct? No, yung mga tyramine-containing food. No? Tyramine-containing food are any food products that has undergone fermentation, okay, aging, or preservation, such as alcohol, no, certain dairy products, certain caffeinated drinks, bawal. Okay? Because if you mix tyramine or if you take these drugs, no, ano mangyayari? Mix Maui with tyramine, no, or any of the drugs na na-mention natin, hypertensive crisis agad ang makukuha mo. No, hypertensive crisis. What is the first sign of hypertensive crisis? It's a headache. No, headache. That's why when you encounter medication questions, no, pharma drugs, tapos may nakita kang gamot, Maui. No, patient took Maui plus some medication and reporting headache. No, huwag ka nang mag-isip. Huwag mo nang isipin. Malamang hypertensive crisis na 'yon, no? So which of the patients should you prioritize? Patient taking Maui, no, and took X medication reporting of headache. Don't think that is definitely a hypertensive crisis because a lot of medications interact with Maui. So if you need to prioritize that patient, no, because this one can kill, no? This one can kill someone. So to treat the hypertensive crisis, Your drug of choice is phentolamine. Oh, na-meet mo na ba si phentolamine? Okay, you have already met this. Phentolamine is the drug of choice of what cancer-related condition? Now, what condition yun? Ayun, pheochromocytoma. Diba? Okay, so that's for your your SSRIs, your TCAs, and MAUIs. Okay, next natin, lithium. No? Sige, screen cap na. Don't bother with this one. No? Just bother with what I say. This is the fastest way to remember this. No? The next natin would be mood stabilizers. Most common would be lithium. Now, lithium. Lithium is a drug of choice for bipolar patient. But pag bipolar, you have two poles, either manic or depressive ka. Lithium has a therapeutic lag of 1 to 3 weeks. But most importantly, lithium exists in a narrow therapeutic index, 0.6 to 1.2 milliequivalents per liter. Greater than 1.2, toxic na siya. Less than 0.6, nawawala yung effect niya. So, nursing interventions natin, we have to take it with food because lithium has a metallic taste. Okay? Aside from that, no, fine hand tremor is a common side effect. So if your patient has a fine hand tremor, that's fine. No? Common yun siya. But if there is coarse hand tremor, that is a sign of toxicity. So, toxicity. What potentiates toxicity in lithium? No? Hyponatremia and dehydration. Hyponatremia and dehydration. The more the patient is dehydrated, the more the patient has hyponatremia, tataas ang lithium level. So it can potentiate lithium toxicity. So it's very important that with lithium, they maintain hydrated. No, they maintain hydrated. Next, the trough level should be checked once a month. No, once a month. The peak level is usually checked 8 to 12 hours from the last dosage. No? This one is important when you're taking it via IV. Lithium does not have an antidote. However, you can increase secretion of lithium. No? If a patient has lithium toxicity, you can help increase the secretion by giving mannitol and or Diamox. Okay? So I know what you might be thinking. Sir, mannitol and Diamox, these are diuretics. Doesn't a diuretic cause lithium toxicity? It does. Tama ka dyan. However, ang maganda sa mannitol and sa Diamox is that on the early stage, it can decrease lithium levels. But as it progress, no, pag binibigyan mo pa siya ng madami pang mannitol, pinapatagal mo, then it will cause dehydration. So we use this one kapag toxic na. No, when there is too much lithium because we want to remove the lithium as much as possible. Okay? So, that's why it's very important to follow this, no? The diet rule of 3 kapag nagbibigay ng lithium. Okay? Number 1, the salt should be around 3 grams per day. Okay? Next, your fluid should be around 3 liters per day. And last, don't drink any diuretics, caffeine, and alcohol. Yan. Okay? So, best way to remember lithium is from the name itself. No? Lithium. Okay. L is the lethal dose of lithium. No? Kapag greater than milliequivalents per liter, this will cause death. Okay. I, lithium is indicated to what condition? Lithium is indicated to what condition? Oh, bipolar. Oh, sige. So, na-screen cap na ba? Okay na tayo dito. Yes, okay. Bipolar. What is the therapeutic range of lithium? 0.6 to 1.2. Very good. No? What electrolyte imbalance causes lithium toxicity? Hyponatremia. Very good. Okay. Lithium does not have an antidote. No, lithium toxicity does not have an antidote. But we can increase lithium secretion by giving mannitol or Diamox. Very good. Diamox. Okay? Ano nga ulit yung um, earliest sign of toxicity sa lithium? It's not headache, it's no, hand tremors. No, uncoordinated or also known as coarse hand tremors. Okay, that's the earliest sign of lithium toxicity. And lastly, why do we give lithium with food? Because M. Ano yan M? Lithium has a metallic base. Very good. Okay. So we will not answer the next one ha kasi for psych na yan siya. No? Very psych heavy yung question. Okay. So our last topic is anxiolytics. Anxiolytics. Anxiolytics are divided into two. Benzodiazepine containing and non-benzo. We will focus on your benzo containing. Benzo containing anxiolytics ends with the word PAM or LAM, such as your alprazolam, diazepam, no? Lorazepam, correct. PAM or LAM. In general, benzo containing anxiolytics are downers. So may idea na tayo. Pag sinabing downer, lahat bumabagsak. Okay? So, indications for this medication is anxiety, no? Insomnia because it can promote sleep. Relaxes the muscle. That's why you give it in NNS para relax yung muscle. Prevent seizures. Okay? Or other types of tawag niyan, withdrawal. For example, alcohol withdrawal. Alcohol withdrawal. Yan. Pwede mo ding ibigay ang benzo dyan. Our consideration when it comes to benzodiazepines is that treatment should be brief. No? Short term lang dapat ang treatment. Short term. Why? Because one of the common adverse effect of this medication is substance abuse or dependence. No? The longer you take this medication, the more you become addicted to it. Okay? So the side effects of this medication is downer. So it's a downer. No? It can decrease your mentation, level of consciousness, no? It decreases your reaction time, lahat na bumababa siya. It's a sedator. Yan. So therefore, nursing interventions natin, di ba? Don't drive. Okay? Don't operate machineries. Yan. If it's a downer, when would it be the best time to give? Kung downer siya. Is it in the morning or in the evening? The night time. Very good. No? Best time to give at evening or at night. No? Kasi matutulog na lang naman siya. Okay, matutulog na lang siya. So, one of the adverse effects of benzos would be respite depression. Okay? Respite depression and toxicity. Yan. So, for respite depressions and toxicity, meron tayong antidote dyan. No? Or your benzodiazepine antagonist. Alam nyo ba what is the antidote for benzodiazepine toxicity? It's your, very good, flumenazine. Flumenazine. This is your benzodiazepine antagonist. Another adverse effect would be your benzo withdrawal. Okay, benzo withdrawal. So in benzo withdrawal, this occurs when you abruptly stop benzos. So you have to taper, no, the dose. Wag abruptly stop. Okay? Because pag nagwi-withdrawal, you will get No, everything is increasing. Upper na naman. Any questions with your anxiolytics? Any questions with your anxiolytics? No questions? Okay. So, we are done with your pharma. Tapos na tayo sa pharma. Hooray! Tapos na. Okay? So again, we have discussed all the top 10 most tested question except ang ating OB. Kasi for OB na yon. No? For OB naman yun siya. So, tomorrow, what we would do is exam lang. Now, the exam is 70 items. It's mixed with your NGN and current NCLEX. It will tackle mostly all of the things we have discussed. No? Lahat ng na-discuss natin ngayon. Before the exam, magre-review muna tayo para hindi natin makalimutan yung ating na pag-usapan. No? So, we will not forget what we discussed today. So, any questions before we finally end? No questions? Did you learn something today? Did you learn something for the 3 sessions you had sa pharma natin? No, may natutunan ba kayo? Very good. No? That's the most important thing is that every time you end a lecture, you walk out a little smarter than everyone else. No? Atik lang. So, a little smarter than before. Okay, so thank you very much. Stay safe and don't forget at night, pray. No? The world is in turmoil, unfortunately. So, ingat kayo. Bye-bye.
Thank you so much, Sir Greg. Nurses, tomorrow we have post-test Pharma 2. So, see you tomorrow, nurses. And don't forget to evaluate the lecturer. And if ever po na may concern o clarification, kindly fill up lang po dun sa concern form po natin. So, see you tomorrow, nurses. And good luck po sa post-test. Thank you, Sir Greg. Thank you, nurses. Bye-bye po. Thank you.